Mystery speaker panel discussion coming up tonight. Oh, goodness. We have so much fun around here. We cheer twice. But we're all good? Thumbs up? Fabulous. All right. Lauren, bring everybody in. I want to welcome to the front up here. We're going to introduce everybody when they get up here, but have a seat, have a seat, have a seat. Yes. Let me know we've got everything. We've got everybody situated. All right. So I'm just going to get started. There's a lot of weird stuff going on in the world right now, and I thought, why not bring in some professionals from outside of here who happen to be patients, who have their own stories, who have their own education, who have their own background, and let everyone out there hear, and for posterity, what they see, what they've been seeing, and let's open up a conversation. How's that sound? So let's introduce everybody. Let's go right down the line here, starting with Lauren.
Okay, I'm Lauren. I'm a nutritionist.
My name is Jim. I'm a nurse, surgical nurse for about 27 years.
And I'm Linda. I was a certified diabetes educator as well as a nurse in pre-op.
Fabulous.
And I am Whitney. I've been a nurse for about 4.5 years now in intensive care, recovery, and nuclear medicine.
Cool. And just everybody so you know, this microphone is for the recording. We still can't hear him back here. Yep, and you guys need to speak up. This mic, you will not hear this microphone coming out of any speakers because there are none. So this is to record. So everybody, so say that all again. Lauren, start over. Oh, and Ryan, just FYI, we have this microphones in the ceiling that you can mix in there too. Okay, so Lauren, starting over. Oh, I should have said, and let's do this too. You know what? See how loud I'm speaking? You got to carry. And let us know back there if you can't hear. I want every word to be heard. So, give your name, give your education, a little bit about your background, your profession, whatever you feel is pertinent to the task at hand. Go ahead.
Okay, so my name's Lauren, and I've been a nutritionist for about 3 years now. I have my Bachelor's of Science in Nutrition and Dietetics. Before I started working here, my background was in nutrition with public health.
Great.
Did you guys hear?
Could that be heard? Yep. Fabulous. Jimbo, go.
So my name is Jim. I've been a surgical nurse for about 27 years. Done a whole variety of different things mixed in there with a little bit of ICU, a little bit of supervision, a little bit of ER, a little bit of this, a little bit of that, but primarily ortho trauma in surgical world. 27
years?
Yeah, 27 years.
Fabulous. And Linda.
All right. My name's Linda. I've been a nurse for 33 years this year. My background is certified diabetes education. I did that for about 10 years or so, and then I went into pre-op over the last 6 years.
My name is Whitney. I have been a nurse for about 4 years now. Good.
There we go.
My emphasis was surgical intensive care. I was certified with open hearts, intra-aortic balloon pumps, continuous renal replacement therapy. I was a charge nurse, and I was also in charge of my ICU shared governance council. So when they wanted to make decisions for the unit's improvement, it came through me first, and I decided if it was appropriate with the managers and doctors. And then I moved into nuclear medicine and cardiac recovery.
That was a mouthful for everybody. I mean, so we've got 27, 33 years, 3 years, and then how many for you? 4? Yeah, right on. So we've got a varied, oh, can you pass me that chair right there, Jane? I need to put something on over here. So do we have that slide prepared, Ryan? Yeah? So just so you know, most of the, everybody here, they've got varied backgrounds, varied numbers of years. And this is just a small smattering of people who are patients here who are from the health field, from the medical field. So when Ryan gets that up, let me know. When you see this slide pop up. Here we go. Medical professionals who come to Divine Design, just blast through all of them. They're all in one slide. Medical transcriptionists, medical technologists, pharmacy techs, radiology techs, surgical techs, registered nurses. 3 of those here tonight as a good smattering of nursing, surgical and all kinds of cardiac, everything. It's crazy. Physician's assistants, personal trainers, physician assistants, massage therapists, nurse practitioners, physical therapists. Keep going. Occupational therapists, respiratory therapists, dentists, dental hygienists, pharmacists, medical management, medical admin. So medical management being the people who work in medical offices like patient care and things like that. Medical admin, so you've got people higher up the food chain, registered dietitians, nutritionists, as Lauren is one, and university professors. Is that it? Oh, marriage counselors, mental health professionals, licensed marriage family therapists. There you have it. So that's just that's everybody I could think of in some way, shape, or form. And we have a lot of nurses and medical management people, this and that. But the dentists, the pharmacists, you name it. However, I wanted to put that up so everybody knows this is not everybody that we have. So they all have varied skills. They all have varied backgrounds. And we want to get into a few topics tonight, such as what do you think about what's going on in the world? What did you think about nutrition before and after you came here? What do you know about censorship, the shots? We're going to answer all of that. But first, we have to build kind of a worldview so people out there in the future and people here understand where we're coming from. So that next question is, now that we know your background, tell us a little bit about your worldview. In other words, and we'll start here since you have the microphone. What's your worldview? Are you an evolutionist? Are you a creationist? Are you a Christian? Do you come from the standpoint of God created us and we need to respect our bodies? Or do you come from a standpoint of everything is kind of accidental? Give us a broad view of your worldview and why you came to that.
Okay, I was raised a Seventh-day Adventist Christian. So Christian is very much what I'm based on. Respect your body. Your body is the temple of God. What you put in matters because that helps you reflect on what you can put out into your community. And so for me, diet and exercise was a big part of my childhood. In many aspects, we did some things wrong from a diet standpoint, as I later learned from coming here. But for the most part, I was raised Christian, and that is my worldview.
Good. Because you'll see your worldview shapes all of the other decisions that you make. Linda.
Okay. I was raised Catholic, and then much later, 15 years ago, 25 years ago.
15 years
Ended up...
These two are together.
Oh, yeah. Oh, yeah. Yeah.
Couple of years.
So then really came to read the Bible and understand all that, and I, kind of piggyback off what you said as far as, your body is the temple of the Holy Spirit. And again, what you put in should be clean. And it wasn't really until I knew about it a long time ago, but it wasn't until I came here and learned more that our whole lives really just changed. And so now what we put in is definitely clean.
Great. Are you seeing a pattern here? What you think about who you are determines all of the decisions that you make. Go ahead, Jim.
Yeah, so I grew up Catholic as well, and we became Christians, born again, a good 15 plus years ago. For myself, I really didn't think about the food aspect of being a Christian, to tell you the truth. I kind of ate what I wanted, and from a big Italian family, I love my pasta. I love everything about it. I love the wheat, love the chocolate, you name it. If you put gelato in front of me, I'd probably, just love it. Anyways.
You're getting distracted. Focus, Joe.
Focus. I know. Thankfully, after coming to Divine Design, realized what those things were doing to my body, and it, and now after about 6 months of being here, that there's been huge transformation changes. From not only just weight, but how I feel. Even though I sound a little raspy and under the weather right now, such is life.
On that.
These things do crop up. Even if you're a patient here, they still crop up, and you still learn how to, work around them and deal with them on a daily basis. Mm-hmm. So it's not that it's not going to happen to you, but it's probably only going to be 3 or 4 days instead of 3 or 4 weeks.
Yes.
Is the big difference.
How many can say amen to that one? Patients here? Yeah.
So.
Right on. Yep. Good. Very good. Lauren, go ahead.
Okay, so I'm a Christian. I was raised and went to a Christian high school and all of that. Went to a Christian university. I was interested in nutrition at a younger age, which is why I majored in nutrition in college. But I honestly didn't start looking at it biblically until I was a patient here, really. Putting those two things together, for me, it was always like Christianity and then like health and nutrition. And I never really paired it together because that's not how the Christian church even talks about it.
Right.
I've never heard a pastor or anyone talk about eating healthy or treating your body as a temple and honoring God by what you put in your body.
Right.
So that was just definitely a huge wake up call, seeing that we need to honor God with what we put in our body, and that matters.
Yes. Wow. Wow. And we didn't plan any of the responses to any of this. Just FYI, this is as organic as it gets. I just had a list of questions here. So it's very interesting that you guys are all on the same page with that. Isn't that interesting? Huh. Yeah, no churches really talk about this.
No.
That's true. Yeah, I can't say I've heard much of that. Okay, so that gives you kind of a background on their background and a little bit of context in their worldview, so that your worldview really helps shape all the decisions that you make. We catch flack from people on a regular basis for being Christians or believing the Bible or, going from a creation standpoint rather than an evolution standpoint on a fairly regular basis. And it's crazy because we're in Cleveland, Tennessee, the hole in the middle of the belt buckle of the Bible Belt of the United States. So I'm okay with it, though. Bring it. So that's your background and worldview. Second section that I want to get to and get to now is health and nutrition. So I'll just ask the question, why don't we just say before and after, what was your view of, like, say, health, nutrition, maybe personally what you did? What were some of the things that, if you don't mind sharing, that you were suffering with or whatever? And then where are you now? Kind of like how we do the testimonials on the internet. So just go through, let me make sure. What was your understanding of health and nutrition before you came here? And then what's your current understanding?
So obviously, with having my degree in nutrition, I thought I knew everything about nutrition. And it was definitely a wake-up call when I started experiencing health conditions that I thought I was trained, the low FODMAP diet, like with digestive issues that I was having, dietitians, nutritionists are trained to pretty much start the low FODMAP diet. And it's a certain diet eliminating certain foods. So I tried that. That didn't work. Tried a bunch of other things that didn't work. Went to doctors. And I was like, wow, like I was trained in nutrition and nothing's working for me. Maybe it's just my body. Maybe I do need to take a medication. And then, when I came here, I found out so much more about nutrition that I was never even taught, which makes sense because what I was taught in school was paid for, by the USDA, by all of that, because it's the Academy of Nutrition and Dietetics, who's funded by the USDA. So if you remember the food pyramids from back in the day, the very bottom one that we should consume the most is grains. And
remember that.
Yes.
Remember that, the food pyramid.
Yes. And that's pretty much the basis of everything I was learned, the guidelines. And I even went online to check back on the Academy of Dietetics and Nutrition to see, updated guidelines and everything like that. And they still recommend the most thing to eat throughout the day is grains, and to limit the most are fats. And
Interesting.
Yes, and that's very different than what we recommend here, and what's worked for me and completely healed the digestion issues I was going through. So
Right.
It was definitely a wake-up call, realizing that everything I learned in school is pretty much, wrong. Nutrition-wise.
That makes two of us.
Yeah.
Anybody out there?
Yeah. I mean, it's definitely a whirlwind when you're like, wow, okay, because everything, I was going through my old notes to kind of brush up on like what I learned in school, and everything for diseases. First of all, we never teach nutrition before someone has a disease; it's after, and then everything is pretty much whole grains, low fat diet, low fat milk, low fat cheese, skinless, boneless chicken breast, all of that.
Right.
And yeah, it's crazy to see.
Well, tell everybody what the problem with that is.
What
What you just said, the low fat, low cholesterol, no fat,
I mean,
skinless, boneless.
yeah. So
What's the problem with that?
our bodies need fat to live. I mean, our bodies thrive off of fats. And so the fact that, you know, our guidelines are low fat everything, avoid any fat you can get, avoid any animal fats, that's a huge issue because our bodies need that to function. All of our hormones need fats.
Yeah. And on the flip side of that, what are they telling you to eat a lot of?
Grains.
Why is that?
I mean, because...
What's the problem with that, I should say?
Yeah, I mean, those are, first of all, covered in chemicals. So pretty much every grain you get from the grocery store is going to be covered in glyphosate and chemicals. And obviously, we know what putting those chemicals in our body does. And on top of that, you know, they digest as sugars and they cause different responses from your body that you don't want, which can lead to inflammation and everything we see here.
Everything we see.
Yeah. So the fact that I was taught in school, you know, high whole grains everything, whole grains at every meal, and low fats, exactly the opposite of what we do here, that we see
opposite.
results from.
Exact opposite. And you said you had some conditions that you
Right.
thought you were eating
Right.
correctly.
Yeah.
Eating properly. I
Tons
should
of
say.
whole grains for
Tons of
my
whole grains.
digestive issues.
Yeah, tons of whole
Low
grains,
fat. I
low
couldn't remember
fat.
the last time I ate butter, red meat, you know, anything like that.
Right.
Because I looked at them like, oh my gosh, those are the worst foods you can eat. You know,
Right.
we've been all, I think even most people have been taught that those are the most awful foods you can eat and put in your body.
Absolutely. If a nutritionist comes here eating incorrectly, how many people coming here are really eating well? Well, judging by what they tell me, it's 100%. Everybody eats okay. I eat healthy.
Yeah.
Right.
So-
Yeah. Let that sink in right there.
So that's a little before and after. I mean, I could go
Wow.
on and on, but those are kind of just the main
Yeah.
things.
And we'll get to your, like, what you think of your profession, what you learned,
Right.
what you know. But
Yeah.
just a little, that's very good. Before and after. What did you know, Jim, about health and nutrition, wellness, before coming here and then after coming here?
Well, I mean, before I came here, you know, health and nutrition was, you know, I should really get on the treadmill. I should really exercise. You know, I should watch, you know, the fats I intake, the salt that I intake. You know, being from, like I said, the big Italian family, a lot of it was all heart disease related. So those were what we're taught, that it's, you know, the silent killer is all the fats and all the salts. After coming here, when I hit the door, this was kind of really almost the last resort, so to speak. I was on about 8 different medications and high blood pressure that was continually climbing. Nothing would change. Didn't matter what I was eating or anything like that. My gut was miserable. Had, you know, digestive issues all the time. And then after getting here and realizing with the first set of tests that, you know, stay away from wheat, stay away from corn, stay away from oats, and then realizing that all of these GMO products and what that genetically modified product does to your insides, what it does to the inflammation process in your gut, you know, what you cannot uptake anymore because they're all in there and, you know, have coated the lining of your intestine, have coated the lining of your colon. So you're not able to uptake any of those vitamins, those minerals that you actually need, and really being taught about that within, I would say within 2 months, I was off probably 75% of my medications. And by 4 months, definitely off everything.
Now, who took you off the meds?
I took myself off the meds.
Important point.
Right, exactly. Took myself off completely. Yeah. And, you know, and that's really with asthma as well.
Yeah.
You know, I had horrible asthma, you
Right.
know, so.
You said something at the very beginning. Remember, heavy grains, low fat. What ran in your family?
All kinds of heart disease.
Heart disease.
Yeah.
If you remember what we talked about at the heart classes, I should say, back in February, you'll learn that heart disease is the #1 killer in the United States, and it's all nutritional. It is all nutritional. Your palpitations, your arrhythmias, all that nonsense. Your
Right.
congestive heart failure, all that. So low fat, high sugar, hello heart disease. It's interesting that they talk about, they make you afraid of fat and salt. What's the most plentiful element in your body?
Fat. Fats.
Salt. Salt and calcium.
Yeah.
Salt. Yeah,
Well,
the
that
mo-
too, just to add in on the whole salt thing.
microphone.
It's funny because everyone, they'd come to me like to give me nutrition advice and all of that. I don't season with a lot of salt. I'm like, why?
Right.
Do you have high blood pressure? No. Like, well, then why are you not using salt? Why are you salt free?
Yeah.
Well, because heart disease.
Right.
Like, well, why would you get heart disease from salt?
The media told me I would.
Yeah.
Right. So just notice
The,
that.
the only thing I wanted to add too was, with the fats is I'd probably been a patient here for about 5 months, and I was noticing that I was getting really foggy, just mentally foggy all the time. And I came in and we, Dr. Brett and I chatted for a little bit, and I realized how little of fat intake I actually had eating just a normal, healthy diet. I mean, steak and vegetables and chicken, just normal, real food. But how low my fat intake was, I actually had to add fats into my diet to bump that up because your brain needs fats. It has to have healthy fats to survive.
Right.
So, yeah.
Yeah. When your brain needs fat and they're telling you don't eat fat, that could explain a few things about why people just don't understand what you're talking about sometimes. That's a very nice way of saying it. I'm almost proud of myself the way I said that. That was really good, wasn't it? That was good. So Linda, so before and after, your health and wellness, nutrition, understanding.
Okay, so I started out questioning things when I became a certified diabetes educator, and I would, teach patients about their diabetes process.
This is good. Oh yeah.
And I was,
This is good.
And I was part of a team that would also recommend diabetes medications, what they would go on, blood pressure medications. There was a standard process. There was a standard formula when a patient came in to see us, that they would be put on, an ACE inhibitor, that they would be put on a cholesterol medication, and then they would always start out with another drug. Am I allowed to say?
What drug?
Yeah.
Yeah, absolutely.
Okay. So they would always start out really on metformin. Whether, and this was just based on their A1C. So
One lab value, and most people went on metformin,
metformin.
on one
Yep.
drug. Most people.
Yep.
Interesting, isn't it?
So they'd walk out their first or second appointment with at least 3 medications. So then, as you're teaching them and you're seeing like these diabetes medications coming in and they're advertised with an apple pie on the front or, blueberry pie, and you're just like, okay, wait a minute, why is this happening? Why aren't we promoting a healthier way of eating?
This is good.
And then I started getting into insulin, and then we became a center that would put patients on insulin pumps. So then I started going out to California to be educated from another insulin pump company, and we would do more teaching and more learning, and so we would put patients on sensors, and they'd come in with their sensor over 7 days, and it was awesome because you could see, like, they could see what they had. They would keep a diet menu area, and then you could see like where they spiked, and when they were low, what happened? Oh, it was exercise or this. So there was a correlation that they could see between the food that they ate and the exercise that they did, but it didn't stop them. It didn't stop them from having, that half of an apple pie, or it didn't. There was no mindset because they were told that they could eat whatever they wanted, and
Take
they would
the drug
just bump.
and, take the
Yes.
drug and you can eat whatever you want. And the
And-
commercials say that if you watch them.
Yeah, and they could eat what they want, and then they could bump the medication. So some could be on like 3 or 4 orals along with some insulin. It wasn't good. And so I started coming home and talking to Jim, and I'd be like, why, this can't happen. So then we just
I want
started.
my pasta.
So even back
I
in,
want my gnocchi.
yeah. So I started slowly, as you
Yeah.
can see,
Yeah.
but, it took them a while.
Look what you did now.
Yes.
Look at this.
But again, we were going by the American Dietetic Association, so we were going by that. So even when I walked in here, they say like, how do you think your diet is? And I'm like, I knew we had some issues, but I didn't think it was that bad until we started going through everything. And then, but now it all makes sense. It all makes sense with what the government and what the medical institutions are trying to teach you. It's completely wrong.
Completely
with,
backwards.
It is.
Yep.
It is.
Why do you think that is? Or if you want to hold that until we get farther down, farther through, that would be a good one.
Yep, we can do that.
Okay, fine.
Okay.
Yeah, because we'll get there. Don't worry. We gotta structure this thing properly. You know? Whitney, the climax, the denouement at the end. So, Whitney, health and nutrition, your wellness understanding before and after.
All right. So being raised a Seventh-day Adventist Christian, we have 28 beliefs that we primarily follow. And several of those beliefs actually tie to our nutrition, being that we are the temple of God and our bodies are the temple of God. And so because of that, I was actually raised what I thought was a very healthy vegetarian diet. The only issues were it was vegetarian, so no meat, but everything else was great. So we had our like Sabbath cereal, which was like Lucky Charms, and it was your Sabbath cereal, so you got to party with the sugary cereal. And we would have tons of pastas and so much soy. My father was actually a marketer and seller of Worthington and Kellogg's, and so we grew up with all of this processed food, but it's fine because it wasn't meat. At least it wasn't meat. So as I grew older, and of course I'm having sodas and teas and soy out the wazoo and all this stuff, and meat was very taboo. Well, as I got older and I went through nursing school and I started working, and people were coming in and they were eating steak and having health issues, and then I would meet vegetarians that were having health issues. And I was like, well, why? And I would know of people in my community that would develop cancer and die. And I'd be like, why? They were vegetarian. Like everything was supposed to be fine. And it became, I got this fear that a lot of people get when, well, it doesn't matter what I do. Disease is going to find me. Disease is going to hit me. Yeah. And even as a young nurse, I was like, maybe I should start getting like yearly MRI scans just to make sure I'm okay. Like let them slice me up a little, make sure I look okay from the inside out. Yeah. I became very viscerally afraid of that. And I thought I was very healthy. Well, then on top of that, I began to develop hypothyroid issues. And my mom was like, oh, this runs in the family. All of your aunts have it. Your grandma has it. We all have thyroid issues. And so before I know it, I'm on a lololestrin. I'm on a birth control pill to help me with my hormones because they're just out of whack. And then on top of that, I'm getting fungus on my toes. And I'm like, why do I have fungus on my toes? I'm 16. And my mom's like, well, it runs in the family. And this is no offense to my mom. I love you. And then I'm having constipation issues. And I'm like, well, this is weird. Again, I'm like 17. And they have a colonoscopy done on me. They think I might have bowel cancer because I'm starting to poop blood, and a little TMI. But this is a healthy young woman. And I was like, what is going on? Like, I'm clearly doing everything right. But again, it became that visceral fear. Like, well, I guess this happens to everyone. Like, no matter what you do, no matter how well you eat, these issues will come and find you because this is a sinful world that we live in. And about 3 years into the nursing field, I see a lot of patients' lab trends and everything, and I pretty much thought I had myself under control with the medications I was on at this point, and I thought I was doing great because I wasn't on more. Like, I would see my patients and be like, at least I'm not on as many as they're on. That's why they're in the hospital. They got all these medications, all these problems. Like, at least I'm just on like 2. It's fine. This is fine. So that was a big thing. And then with a lot of my patients, I began noticing blood trends, like albumin, for instance. The amount of protein you have in your body, albumin is one of the ways you can test that. And with a lot of our patients, we were doing surgeries on them when their albumin levels were extremely low. And typically when your protein levels are really low, that means you will have a harder time recovering after surgery. The body needs proteins and fats to recover after surgery. So I'd speak with the dietitian that would round in our unit and be like, so what are we doing to build the protein? And they're like, oh, we give them like a little protein like powder that we like mix in with their coffee. And I'm like, that's it? And they're like, that's it. And I was like, well, that's interesting. And then I was like, well, that makes sense though. I'm a vegetarian, so we take a lot of protein powder too. So I guess it's fine. But this caused me to start questioning it more and more. And then we were doing surgeries on patients where their albumin levels were incredibly low, but they were saying it's an emergency, and it's not an emergency back procedure. It's just not. And so they'd come back and their albumin levels were even lower. And I'm like, well, they're not going to heal because of this. And I just began questioning nutrition from the inside out. And what I began to discover is myelin, what makes up our brain, what helps us make decisions, is made up of protein and fat.
Ding, 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 ding.
Yeah. So it's not
Write
made
that
up of it's not made up of soy and the processed foods that we consume. And I began thinking, well,
I would write that down if I were you.
yeah, it's just that's huge. And the fact that your body doesn't actually need that many carbs. It needs that protein, it needs that fat. And then I began questioning, I've lived my entire life with a lot of synthetic protein, not the real deal. And this caused me to begin researching. I listened to a lot of books. I listened to one that was called The Big Fat Lie, which is all about debunking a lot of the American Heart Association and what they have to say about how fats actually are processed by the body. And this caused me to actually quit being a vegetarian. I began consuming meat by choice, began quitting things like soy, and it was about a month after that that I found Divine Design.
That's fire right there. That is fire. And so some of that I didn't know. I didn't. Yeah, yeah. Always full of surprises. And we even did a class, the last, maybe not the last one, but the mystery speaker panel discussion from a while back. We had two people who worked here who used to be was raised vegetarian, and then another who became vegetarian by choice. And we compared and contrasted the vegetarian lifestyle and where it comes from and what it's all about. Is it a good, safe alternative? Is it what you think? And it's basically what the same thing, the same conclusion that Whitney came to, both Nadia and Andrea, who's here tonight, came to. So let that sink in, because everybody right here, pretty much to the T, said the same thing, that we're not being taught the truth about nutrition and health, and that the other thing was your body is made of protein and fat, but humans, and particularly Americans, are eating too much what? Carbs or sugar, yeah. Carbohydrates or sugar. So we can get more into that. We teach whole classes on it. Food, what do I eat? Those classes, we have tons of classes on the food stuff. So that being said, it's interesting that you all notice the same thing. Fabulous. Wow, that is good. That's good stuff. How many of you are taking notes? Right on. A good chunk. All right, now, as far as profession goes, let's talk about what did you think of, and what were your thoughts and feelings on your profession now, knowing what you all just talked about, how we were taught incorrectly, and then we're treating this, but maybe we're not treating it correctly if our education on what we feed ourselves 21 times a week is flawed. So take your profession and compare and contrast it to before and after what you just learned.
Well, I was already becoming kind of frustrated with my profession, but it was more of a patient advocacy standpoint, which would still apply to a lot of people here who, at one point or another, most of us have been patients. The struggle I had, and I worked in a critical care setting, so I got patients when they were very sick after a surgery. I helped recover them. I worked with an interdisciplinary team to rehabilitate them and get them ready for discharge after very big surgeries. And the issue I saw was when I began questioning leaving vegetarianism and beginning to eat meat was the lack of nutrition and the glorified food that we feed our patients in the hospital. It really bothered me. Like, I would bring the tray in and be like, I would literally say, here's our well-seasoned cardboard, I'm sorry, and give it to them. And they would laugh. They'd be like, oh, you're right. And then they'd sprinkle some Mrs. Dash, that was the seasoning, because they couldn't do salt. They weren't allowed to have salt, and eat it and go for it.
In the hospital?
Yeah. Most patients are not allowed to have salt. It's Mrs. Dash, because salt is
I didn't know that.
Yeah, fun facts. Well, and so at least I was like, well, maybe I can like counteract by giving them a lot of protein. And so I'd get those Ensure drinks and start giving that to the patients, sprinkle the Juven powder in it, like trying to bulk up their protein.
What is Ensure, just so everybody knows?
Well, I read the back of the label. So Ensure is a protein drink. And they're like, yeah, it's really great. And it doesn't spike your sugar for diabetes. Like, it's super healthy. It's like the best protein drink in the world. And then you read the back and it's like, no. Like, I think there might have been like a smidgen of whey in it. Yeah,
it's on TV. The commercials you've seen, Ensure, and what's the other one? Pediasure.
Glucerna's another one.
Glucerne, Pedialyte. They're all made by the same company. It's a laboratory called Abbott Laboratories. And if you look on the back, just like what Whitney was saying, it's chemicals and it's artificial sweeteners, I believe. It's soy protein, the little bit of protein that
Lots of soy protein.
is in there. The little bit of protein that's in there is soy protein isolate, which is isolated, synthesized, isolated protein, and chemicals, and artificial sweeteners and colors. And that's what most pediatric patients are fed. And also Ensure, where do they feed people Ensure the most?
Nursing homes.
You got it. So your grandparents, your parents, your aunts and your uncles. That's what they're feeding them. Keep going.
So I was questioning all of this, and I would speak with our dietitians about it and be like, hey, is there anything else we can do? And they'd be like, oh, we can have like tube feeding, which is like IV, or it can go down your nose or your mouth in a little feeding tube. It's like a little protein there. Well, I read the label on that, and that was all synthetic too. And so being the chair of the shared council I was part of, when we had our monthly meetings, I began presenting this like, hey, we're having issues here where I don't think we're giving people good nutrition. And I was literally told, Whitney, that's not our job. And I was like, well,
You won
I feel
the
like it's part
popularity
of,
contest, didn't you? You
I
got
didn't
really
last
popular
long.
that day.
You know what? I became chair for like 3 months, and then COVID hit, and I was like, I think you all planned that, so I wouldn't be chair anymore. But anyway, so I was pushing. I was like, I think we need better nutrition. And around this time too, nurses were beginning to argue that they were like, hey, they bring around the snack cart, and even nurses, like, we're given Snickers bar, Reese's, animal crackers. That's the healthy one. The Welch's little fruit gummies, we were given that too as the healthy snack on night shift for nurses. And I was like, we need to bring in good health. Like, no wonder the nurses are fighting. No wonder nurses have burnout. No wonder our patients are miserable and depressed. Like, we're not feeding them right. But the more I questioned it, the more I was told that's dietary's problem. And I keep looking at you, it's not your fault. It's not you. And when I asked dietary about it, they'd be like, well, per our protocols, this is what we can give them, and that's it. And that began to really bug me, and I began doing more research. I actually ended up transferring out of that unit for many reasons, but one of the reasons was I did not agree. I felt like we were doing a disservice to our patients by the way we were feeding them.
Wow. Oh, yeah. How many of you know what she's talking about? Have you ever gone to visit somebody at a nursing home or in the hospital post-surgery? Is what she's saying true? Yep. Or is that false? True. Every single person in here knows that that's true. That's the state of your healthcare. And remember, when you go to the hospital, you walk in the lobby, there's a McDonald's on your left and a Starbucks on the right. You want to know? Somewhere in between. You want to know how you got? Yeah, and Chubway somewhere. A Crackdonald's on the left and a Starbucks on the right. But then you want to know how you got on the 6th floor? You spent a lot of time on the first one. That's how that happens. Good. Power. That's heavy duty. Linda, bring the wisdom.
All right. Well, I was very excited as a new diabetes educator, and I was so excited. I was going to change.
She was inspired.
I was going to change everybody's life as when I saw things, when I saw numbers. And I tried. I mean, at the hospital, I was in charge of also bringing in new curriculum. So I brought in new curriculum. And still, numbers did not go down. I did so much studying and researching and looking at things. We talked to our dietitians, but again, they have a formula. And so they would go in, they would see the dietitian, they would meet with them for an hour. They would have this formula that they would come back with. And I'm like, but no, can't you see that Twinkie is doing something to your blood sugar? That if a Twinkie can live outside of a packet for 15 years and we have it here at the hospital, then what is it doing inside you?
Wow. Think about that.
Mm-hmm. So then after,
hold on. How prevalent, just so everybody knows, you probably know the numbers better than anybody. How big is diabetes right now?
It's huge.
Like on a scale.
It's huge.
Every other patient has it.
It's
Every other patient.
Mm-hmm.
Insulin
And
resistance is the top issue on earth.
But
That's a good point. They're getting younger and younger.
But they're young. So
and they're getting younger.
yeah, towards my last couple of years there, we started seeing, 15, 16, and not with type 1, but with type 2.
So adult onset
diabetes
in
was-
13, 14, 15-year-olds.
Yes.
Oh, wow. Look at
Yes.
American healthcare.
Yeah.
I'm kidding. It's crazy, isn't it?
It is.
So diabetes is taking over top of the charts. Insulin resistance, #1 health issue on earth today for humans.
Yeah.
Insulin resistance.
But look at
Wow.
all the meds that they're on. Look at all
Right.
the diabetes medications we have. We have greater than 30 to 40.
And wouldn't you
It's-
say that with that younger population, a lot of them are on psych and mental disability?
Oh, yeah,
Yes.
Substance
Yes.
abuse.
Yep.
They were saying with the younger population, a lot of them are on psychiatric meds.
Yep.
So how that goes together with the diabetes meds is anybody's guess because there's no research on it. Interesting.
But
right?
don't forget the PPIs that they're also taking as well.
Proton
So
pump
a lot of that-
inhibitors that they're taking.
Yes.
Proton pump
So you've got
inhibitors
the antidepressants,
Antidepressants.
the PPIs.
and the PPIs. Proton
They're
pump
all-
inhibitors. Explain a proton pump inhibitor. Just tell people what it is. PPI.
I mean, it just helps with reflux.
Well,
does.
it shuts off your stomach acid.
It does.
Yeah. Shuts off your stomach acid. So is that going to help you digest your food or help you not digest your food? Right. So you're not going to absorb. So now you're going to have malabsorption problems.
Yes.
Those are all your Nexium, your Zantac, your Prilosec.
Yep.
You guys could probably name Pepcid.
Zantac, right.
What is it? Reglan?
Reglan's another. Yeah.
And all of our patients, for legal reasons, when they're admitted, they get a Docusate, like a stool softener. They get a Pepcid because we tell them you're laying in bed for a long time, so we don't want you to develop stomach ulcers. And then we give them like a Lovenox or heparin shot so they don't develop blood clots. So you get those 3 things no matter what when you walk into the hospital. You're staying one night, you get that.
You stay in the hospital. Say that all one more time. I didn't know this. I didn't know this.
It's for our protocol because the legalities.
Docusate. You get a stool
Docusate,
softener
stool softener.
because you're laying in a hospital bed.
Pepcid, and you're being fed our food, so you're going to have the constipation.
And you're getting crap food. So then number 2,
Pepcid.
Pepcid. Oh, well, we'll get it back.
Pepcid for the stomach ulcers.
For the stomach, what stomach ulcers? That they're going to develop from the food?
Because, well, if you lay there in too long with that kind of acid, obviously.
So Pepcid. So this is standard. Everybody gets this?
Yeah.
Didn't know this. I'm learning.
And then Lovenox for blood clots. Or heparin.
Preventative? for
Yeah,
blood
because
clot?
if you're laying in bed for a while and you get the stasis, the blood stasis, you can
yeah.
develop blood clots. So what it really
Wow.
is
I had
it's
no
the
idea.
hospital protecting themselves from legalities. So you're laying there, if you get a blood clot, you
Yes.
can't be like, I'm going to sue the hospital. We'll be like, no, we gave you Lovenox. It's a way to help the hospital and cover our tails.
And when a doctor gives you drugs, he's covering not your butt, but his.
Yes.
And I'll let you guys speak on that for a little bit because there's something called standard of care. I've spoken on this many times. If that doctor doesn't give you a blood thinner or a blood pressure med or whatever is indicated by your numbers or your labs, his license can go bye-bye. So he's not covering his butt. He's not looking out for your health. He's looking out for his. Mark my words. Linda, go ahead and continue. That was good. That was good. No, that was a good point. See, I didn't even know that.
Yeah.
You get checked into a hospital, and that's those 3 off the top, no questions asked.
Yes.
Correct.
At
Unless
least.
you're allergic, then we'll choose a different drug.
Then we
It-
use, we have others.
If you're allergic, we'll do a different drug. See how? So that's just the protocol. How does that work for everyone? It doesn't. There's no science to that. Go ahead. Gosh, that's. Go ahead, Linda.
So I'm going to go back to the diabetes because I had
Yeah.
because I did that for a long time, and I started out, like I said, extremely energetic, and then towards the end I was just very frustrated. But the reason why I was frustrated is because I saw my patients actually decline. They come in on maybe a Zantac, and then they end up with the metformin, and then they end up with possibly another oral, but then it's a cholesterol med. Then for men it was they had erectile dysfunction. Then it was like an ACE inhibitor. Then it became a beta blocker. Then there were just so many meds that just got added on, and
Right.
they're all causing.
The downward spiral.
They are, and then the antidepressant. I don't think I said that, and then that's part of it too. Because all these have side effects. If you watch your commercials on TV, what do they tell you?
Right.
Well, yeah.
Because death.
It causes things worse than the condition you're
Right.
taking it for.
Yeah. So I started watching like all these patients just kind of really go down the toilet, and it was really sad because they started out 5 years before, and then now they're on insulin. Now they're taking insulin 4 times a day, and
Wow.
and
So
they
you
have
had
swelling
like
and
4 or 5 years to fix this.
oh, I had longer than that, but yes. Yeah,
So
you can
you're
just-
dealing with a specialized diabetes educator within the realm of registered nurses who's dealing with the largest health issue ever in the history of recorded civilization and having years to fix it. And we still struggle. And the hospital and the doctor's offices, we're still struggling with it.
They do, because they're, again, there's a standardized care that they give.
Okay.
So I would go back to, one of the family physicians and I would say, okay, this is this, can we take them off of this? No, we can't take them off of that. Can we, do something else? This is what they're going to choose to change in their diet. No, we can't do that. We need to keep them on this now. And it was extremely frustrating.
Yeah,
And
sounds like it.
towards the end, Jim knows, I was done. I did not see that any of the patients got better. That was the sad part.
Really?
Yes. So then I went into a different department. It was really taxing.
That had to be very depressing and very frustrating, beating your head into a wall. Would you see any of well, of course the doctors couldn't say, yeah, get them off this and that, but would anybody, how many people woke up and got it and realized, I'm killing myself, I'm going to change my diet, and broke out of that like you guys did?
I had one patient. He came about that. So he came to a diabetes class and he came in and he said, I'm really sad. I had to break up with my 2 best friends this week. And we're like, oh, everyone around the room is just like, oh. And he goes, Ben and Jerry. Ben and Jerry.
Because this was East
The
Coast.
ice cream.
This was back in Boston.
Yes.
Okay.
Yes.
Wow.
But he's the one who he did great. He listened to everything that we taught him. Even on the side, because of course we're giving books by the American Diabetes Association, so everything that we're teaching them is from them. Even down to like the glucose tabs, all this stuff that we would get free from the company. So
Wow.
yeah.
So you're dealing with teaching people how to prick their finger and
Yes.
how to measure their insulin.
How to put on
And
pumps and
how to do
deal
the
with them.
insulin pumps.
Yes.
And now, too, they have the meters that you can scan with your
Yes.
phone.
Yes.
So imagine, this is such a pervasive and ubiquitous industry, insulin resistance. And so you were dealing with and teaching people all of this technology stuff
Yes.
that's now tying into people reaching the singularity and just having sensors and things tied into the Internet of Things. This is great.
Yes.
Wow. Wow. That I didn't know. Wow, that's great.
So
Yeah.
I'll take things into a little different avenue because surgery is where I've been primarily in, orthopedic trauma, but orthopedics in general, along with, general surgery, a lot of breast surgery, a lot of breast cancer that I've helped out with over the years. And, prior to coming here, what I thought about my profession is that we were wonderful. We fixed everything. We fixed breast cancer. We fixed colon cancer. We fixed, if your knee was out of whack, we went and replaced it with a brand new joint. That was, we did the lion's share of the work in the hospital. Fast forward, divine design.
Here goes.
Looking at my profession now, the reason I stay in my profession is that, the gate for this, for what divine design does, is very narrow. As you probably know 100 people who would never come to divine design because they don't want to give up their Krispy Kreme.
Yep.
Okay? So those people are going to have tumors. They're going to have bad gallbladders. They're going to have colon cancer. They're going to have all these things. If no one's there, and I've been doing this long enough now, that a lot of what I'm doing is teaching the next generation of nurses to function in this role. And there's fewer and fewer and fewer that come into this profession in the way of surgery and surgery technicians, that I feel it's really imperative now that I stay there just in a teaching role. But what I think about these things is they're all preventable. Unless you're in a car accident or you fall off the ladder and you break a bone or something like that, obviously we need to fix that. That wasn't something that you intended to do that, happened because, you ate, a box of cereal, for your entire life. But I see all these joint replacements, and I see the pain that people are in, and I see their perception of pain. And we're all taught as nurses that pain is whatever the patient says it is. So that your pain is different than your pain, that's different than your pain, but it's all pain to you. And that's the primary reason why people are coming in for all these joint replacements. But in reality, if they had the proper diet and they had the proper things going forward and the proper nutrition, vitamins, and minerals going into that bone, they wouldn't have these issues. It would eliminate probably 75% of orthopedic procedures in the country, which is detrimental.
Wow. Say that again, Jim.
Would eliminate probably at least 75% of all the orthopedic surgeons, all the orthopedic procedures in the entire country.
So name some of those procedures so that people can put a face with a procedure, because you all know what these are.
Right.
Name some of these.
They're knee replacements. They're hip replacements.
Knee replacements.
Those are the primary pieces.
Does anybody in here know anybody? We'll walk through this list,
Right.
dude, because this is fire. This is great for people to know. Raise your hand if you know somebody in here who's had a knee replacement. Every hand goes up. What's the next one?
Hip replacements.
Raise your hand. How about somebody with both hips replaced?
Yeah.
Both knees and still having knee problems.
How about both? Yes. How about both knees being replaced? And then do they? Yeah. Oh, well, raise your hands high. Look at so the camera can see this. Raise your hands high, both knees, and now raise your hands if it's both knees and they still have knee problems.
Right.
Hello. Are you seeing a pattern here? What else, Jim?
We're talking about shoulder replacements.
Shoulder replacements. Anybody?
Those are becoming more and more prevalent.
Those are becoming a huge deal. Shoulder replacements.
Now, each one of these surgeries is over $100,000 to be done. Just the average cost of the parts on a knee replacement that we put in, what it costs the hospital is, any guesses?
What it costs the
What
hospital
it costs the hospital to buy the pieces
for a knee replacement?
for a knee replacement.
You
So
have to buy it from the company that
so
makes it.
the wholesale price, I'm going to say $60K.
No, for the pieces, they're about $10,000
Oh, but you're not talking
wholesale.
like
Just the pieces.
but we're talking like, don't they do like the head of the tibia and
There's
But the
head of the tibia.
individual pieces,
Yep.
10K.
There's four.
oh.
There's 4 pieces.
Oh, there's 4 pieces.
2 metal pieces.
Okay.
2 plastic pieces.
Oh.
$10,000. That's what the hospital pays. Now you are going to pay $50,000 for those pieces.
I said that was my retail guess, didn't I?
10 or more. Yeah. If it's a specialized knee, they have what they call these contour knees that you go in and you have, a CAT scan done, and they'll actually map your original knee.
Yep.
And then they'll go ahead and custom make in a 3D printer, basically, a new knee for you. So we will cut your knee out, place that new knee back in, and those are at least double the price.
Wow.
Yeah, to the hospital, those are $25 to $30K.
That's
It's
heavy.
big business.
So you're saying 75% of those nationwide would probably go away if people learned
Proper nutrition.
what
Yeah,
we teach here.
correct.
So I don't ever want to hear somebody say, I can't afford natural health. You have a knee replacement and you just nixed 10 years of being here. Unreal.
Right.
It's all about priorities. It's all about value. Wow. What are some of the other big procedures or some of the other common procedures?
What's that?
Backs and necks and
Oh, a
spines.
ton of spine surgery. Not necessarily at the
fusions?
place that I'm at right now, but a lot of disc surgery is huge. Infusions. People that have had a disc, that's a bulging disc, they pull the disc out.
Yeah.
Now they actually need to put instrumentation in to actually stabilize the spine. There's a lot of that. Generally speaking, anytime a patient has a spine surgery, There's usually one guarantee that they'll be in for another,
Always.
Chronic
always,
back pain.
because chronic
Always.
back pain.
Failed back surgery syndrome. Do you
Correct.
know about this?
Yep.
FBSS. It's a new condition. It's a new insurance code. It's a new, every insurance code is there for a reason. And failed back surgery syndrome is a brand new thing.
Gallbladders, appendix, they are, rampant, especially gallbladders are,
Why
are
would that
just
be?
rampant.
Why?
It's Wendy's, McDonald's. There's the classic. We would always know that after certain dates in the year, if you were on call for that night or for that
What?
weekend, you were going to be busy.
What? Like what?
Thanksgiving, Christmas,
Unbelievable.
the Super Bowl,
All the alcohol, with all the
Super
gallbladder
Bowl,
and appendix
all
stuff.
the gallbladder.
Never
yeah.
crossed my mind.
Absolutely. So we would get prepared. We'd be ramped up for those. Yeah, and you're guaranteed at least double your population, or in the hospital's case, you double the income. Wow.
Oh.
Merry Christmas.
Ah.
Yeah.
I had no idea.
Yep. And now with the introduction of the robots,
Oh, here they come.
okay.
Here they come.
Thankfully, I'm not going to say where I work right now, but what would cost for us to do the procedure? I'm not sure what the patient gets charged. I really don't know. But for us to do a procedure, a regular laparoscopic procedure for a gallbladder, remove a gallbladder, was maybe $1,000 in equipment costs, maybe.
Here goes. Here goes.
With the new robotic technology,
He wants you to guess.
Oh, with like Robo Michelangelo cutting on you, I would say
Yeah. with Michelangelo cutting on
instead
you,
of $1,000, I'd say it'd be $8,000.
you'd be more in the vicinity of about $15,000 to $18,000.
What?
Yeah.
$1,000 surgery turns into
And-
15,000.
And what we could do in
What?
a half an hour now takes an hour and a half to 2 hours. So that triples your anesthesia time, your money. It triples the money that you pay for the operating room because we charge the operating room in minutes. We do not charge it by the procedure. So every minute that you're in the operating room, from the time you wheel into the door till the time you leave the door, is
What?
charged by the minute.
I had no idea.
And
So if you don't-
What?
ICU with me afterwards.
So you
Correct.
go get your stuff ripped out, and then you come to your place.
Correct.
Used to.
Right.
So why does a robot take 3 times longer than a surgeon doing lapro? Why is that?
It takes longer for the setup. It takes longer
I
to
thought-
get into the abdomen. It takes
I thought robots were
longer-
supposed to speed stuff up so they could pull out more organs.
No, it doesn't. Speed
Not
things
yet,
up.
but you
No.
mark my words.
No.
Soon as in the near future.
Well, so the claim to fame on a robot is that it's more precise. Originally it was the sites that we're going to put into your abdomen are smaller, but they're actually the same size. I will say, in defense, to some minute degree, the doctor does have a lot more mobility with his hands with a robot. He can turn 360. He can't turn his hand around 360.
Wow.
But, ever since I've been doing this, matter of fact, when we first started, they were doing the first laparoscopic, gallbladders
Right.
back in the 90s. Yeah. And it was all the rage.
Yeah,
Which is
right.
wonderful. It's great technology.
Right.
But, just because you can doesn't mean you should.
Right. Absolutely.
So,
you're under, so it's 3 times the cost, or 10, 15 times the cost. You're under.
Correct.
But notice what he said there. You're under anesthesia for 3 times as long.
correct. So that's 3 times the drugs. That's 3 times the anesthetic.
3 times your chances of developing further mental degeneration
Correct.
farther down the road. Because how many times can you be put under anesthesia until you develop certain conditions? Right?
Right.
We'll-
And every
we'll get into that
anesthesia is
later.
not the same.
Right.
You have, they all
Fascinating.
have, every single individual that does anesthesia, and whether it's a nurse anesthetist or an anesthesiologist, they all have their cocktail that they use.
They all use different stuff.
They all use different stuff. Some use 3 different medications. Some
What?
will use 10 different medications.
I thought it was all standardized.
It is not standardized.
I thought, what?
There is, yes.
Propofol, fentanyl, Versed.
Yes.
for
When we
sure.
put you to sleep, there's a certain queue of drugs that we'll use.
But the anesthesiologist has his specific way to
Correct.
take you to the edge of death.
They may add in some ketamine. Some don't. They may use a blood pressure support. Some don't.
Did anybody else know this? I had no idea.
So
You have to remember that when you
I had no idea.
Well, you know, when you go to sleep, when you go under anesthesia, like your body doesn't have control of itself anymore. So the medications we give you is what keeps you alive or keeps you closer to the brink of death. So when you have surgery, you get a lot of medications. Wow. Whether you know it or not.
Know that. The anesthesiologists have their proprietary cocktail.
correct.
Unbelievable. Unbelievable. I gotta go run around the building a couple times after
So
that.
that's kind of my take now
I had
on
no idea.
what I do for work, and what my original understanding was, that it was wonderful, and now I'm glad I'm there to train the next generation.
Yeah.
And there are a lot of great things that that surgeons do, and I work with a great group of guys right now.
Yeah.
Women.
Yeah.
But
but it's a total sea change.
it is. I find myself
Where you were and where you are
I find
now.
myself praying a lot more than for
Yeah.
my patients than I do.
Yeah.
Input into
Right.
what I'm actually doing.
Right.
Yeah.
Wow. That's great, man. Wow. I might have to go back and rewatch this one. Good grief. This is ridiculous. Lauren, so the view of your profession pre and post.
Yes. So when I graduated college, I was all excited because I thought I was going to help people with nutrition and make people healthier. So my first job out of college was with WIC. So my last job, it's the women, infants, and children through the health department. And I mean, right away, so back up a little bit. So as soon as I graduated, I was going back and forth whether I wanted to pay for a very expensive dietetic internship or not. So basically what that is that is a 2-year unpaid dietetic internship just for nutrition. So nutrition, hear me out, is a dying profession because they're making it that way. So to become a registered dietitian now, you have to have more education than a nurse who actually has hands on someone and is putting drugs into them, and a physician assistant. So just to become a dietitian, to tell someone what to eat, you have to have more background and training than a physician assistant. Yes.
I did not know that.
Yes. So why I didn't do it.
What?
So all of a sudden, my last year, senior year in college, the Academy of Nutrition and Dietetics says, you know what? You can't become an RD anymore with just your bachelor's. You have to have your master's degree.
Yeah. Yes.
So-
this sounds familiar.
And this was when my best friend was in PA school. So keep in mind, to become a registered dietitian, just to tell someone what to eat, I'd have my bachelor's of science.
It's 4 years. 4 or 5.
years. I had to do my master's
So
in
2 or 3.
nutrition. So 2 years is what the standard is.
So 7-ish years.
And then do after those 2 years of my master's degree, do a 2-year unpaid dietetic internship.
2-year unpaid.
Yes. Where my best friend, that's a PA, she did her 4-year undergrad, 2 years of her Master of Physician Assistant program, and her internship was included in that.
Right. Yeah.
So
Right. So
to
it's
just
harder.
teach someone nutrition, I had to have more education than a
Yes.
physician assistant.
So they make it harder
Yeah.
for you to teach someone how to eat than they make it for someone to become a physician's assistant.
Yeah.
Paid way less than
Oh,
physician
way
assistant.
less. Yes. So just
I
let
did
that
not
sink
know
in
that.
too. That
I did not know
Yeah.
that.
Yeah.
Let that sink in. That's a perfect segue. We'll let you go on a
Yeah.
minute. But here coming up, we're going to talk about censorship and why there's so much misinformation about this topic known as nutrition, which we talked about right at the very beginning with the fat thing and the salt
Yeah.
thing.
so
I did not know that.
yeah. So most people my age that got their bachelor's in nutrition, they are not registered dietitians. They did not go forward with it because the amount of schooling you have to do is just insane to talk nutrition with someone. So I decided I wasn't going to do that because my school was like, oh yeah, you can automatically roll into our master's program through Loma Linda, and that's going to be $150,000. So I was like, yeah, I can't do that to get paid $40,000 a year. Yeah.
But you didn't know that when you first started. You just
No.
did it
They
because
switched-
you liked nutrition.
Exactly. And I thought, nutrition, a 4-year bachelor degree and then a 2-year dietetic internship. But the regulations were changed my senior year in college.
Don't you love that?
Yeah.
We've all been there, haven't
Yeah.
we? Wow.
Yeah.
Okay.
So,
no way.
so then I was like, I'm not going to do it. I don't feel comfortable going into it, spending that much money to make very little.
Right. And did you know anybody that was doing that?
I didn't know anyone my age from my program that was doing that.
But I mean, did you have a mentor or somebody that you knew, somebody you looked up to and said,
Yeah.
I want to practice the way they do? Or something?
Yeah. So I knew a couple of older registered dietitians, and they all told me, don't do it. They're like, no one respects you. No one cares about nutrition. And when you're in a hospital,
Yes.
doctors don't care to send their patients to you.
Sounds
It's too
like,
hard for
yeah.
doctors to
Sounds
go
like
through all
chiropractic
that.
school almost.
Yeah.
I think we went to the same school.
Yeah.
Wow. No
So, every single registered dietitian I've ever talked to, when I was trying to figure out what to do, said, do not do it. It's not worth it. No one respects
Wow.
you. Yeah.
So that's how hard, that's how hard they make it for people to learn what to eat. Remember that.
So she's absolutely right. I'm just going to take it for a minute
for
because
it.
when I first took over the department, I went around to every single family practitioner's office and asking them for I had a list. I had already compiled a list of their patients that had the code of diabetes and asking them for referrals to bring them into our department so we could teach them about diabetes as well as nutrition because it was a double. And even with going to every single office, we still got like just little patients. So say we got like 15 patients from each office. And
Not refer them.
they were not, they were,
several hundred.
yeah, they just,
15 patients, 15
patients out
from
of each
practice.
office.
Out
So
of
say there-
hundreds of offices?
No, out of
Oh.
hundreds of patients with the diagnosis code
Oh,
for
hundreds
diabetes.
of possible patients, they threw you 15.
Yes.
Wow. Why would that be?
That's it.
Why?
It's easier to throw a medication to something than it is to actually teach someone how to eat properly.
Write that down.
If they were to refer her,
Yeah. Yes.
if doctors were to refer you to dietitians, to diabetic counselors, they prescribe less medications and they're not fulfilling
There you have
their
it.
protocols.
There you have it. Wow.
Yeah, no. Which is why dietitians are going to be not a thing in the future.
Right.
Because they're going to make it so hard.
Right.
Because why am I going to go to school more than a physician assistant
Right.
to just tell someone how to eat? So, anyways, I
Right.
decided I wasn't going to do that. So then I went ahead because
not
to
know
work
that.
for public health for WIC, you don't have to have your RD. You just have to have your degree in nutrition and dietetics. So I had that. So I went into it and I was like, this is cool. It's the Women, Infants, and Children program. I'm going to teach kids, pregnant moms, postpartum moms, all of that, how to eat. This is going to be great. So, going into that, I realized real fast, no one cares about nutrition, especially for their kids. People feed their kids, complete garbage. Mountain Dew and baby bottles. It was like the wake up call for me. Yeah.
What do you
Mountain
mean?
Dew in an infant baby bottle was that.
Oh, and if they can't afford milk, the milk on the WIC protocol is
Right.
soy milk.
So
Yes.
well, so you have choices.
Yes.
There's regular formula. So what started waking me up was I was starting to do my research too before I even became a patient here. And a couple of things at the health department I would get in trouble for as a nutritionist. My job was to educate nutrition to the parents about their kids and themselves if it was a pregnant mom. And if I didn't put in my note that I pushed for a flu shot or their vaccines, I would get in trouble from my nutrition director. I'd get audited because
Why does that have anything to do with the nutrition?
Why does that have anything to do with nutrition?
Yeah.
I mean, it makes them even the kids even more unhealthy than they already are.
Right. So you got busted for not pushing flu shots.
Right. And then on top
Interesting.
of that, fluoride
Interesting.
varnishes. So the kids would come in, we would get a little ticket. And if we did enough fluoride varnishes for the month, we would get a special parking spot.
What is the fluoride?
What is a fluoride varnish?
So
I have
it's
no idea.
the nurse would come in and they would dip the brush in this fluoride varnish serum and brush it on the kids, all over the kids' teeth.
Oh.
Yeah. And that was free.
And you get enough of those and you get a good
I
parking
get a good
spot.
parking spot. So, yeah.
Right.
So and then, my
you
nutrition note, they
hearing
wouldn't
this?
even care about, so it's like, if you didn't push for the vaccines, make sure they're up to date on vaccines, push the fluoride varnish, you were in trouble. Nutrition, they didn't care about.
I want
Yeah.
to run around this building right now.
Yeah.
You guys are blowing my mind right
Yeah.
now.
So,
I can't believe it.
realizing that, first of all, nutrition didn't matter. They didn't care. I started seeing all these weird things. I'm like, I'm a nutritionist. Why does it matter if I push the vaccines? Why does it matter? I can't even do a fluoride varnish. The nurse has to come over and do it. So why do I have to push it?
How many parking lot spots did you get?
0.
Yay, Lauren! Okay, go on.
So, and then, I started piecing things together. So we'd obviously give formula. So we did promote breastfeeding, which is great, but we gave out just as much formula than, breastfeeding moms. So, no one ever really said anything about what's on the formula can. They never questioned the ingredients. No mom ever did. So then one day when I got formula and I had to dump it because their baby got switched to a soy formula, I turned around the can, and the first or second ingredient is high fructose corn syrup in infant formula.
Infant formula.
And then, just so many other things that are awful for you, but that really stood out to me is high fructose corn syrup at birth,
At birth.
At birth.
A synthetically derived sugar that's often made with mercury for the babies, along with a fluoride varnish into the gums, a highly absorbent part of the body. It tells you the agenda, doesn't it? It makes me want to puke.
Don't they give formula when babies are just born?
Yeah.
Yeah.
Oh, yeah.
So their first meal is that?
Right.
In many cases, yeah, I thought mama.
In the hospital.
Yeah.
That's what I'm saying.
In the hospital, yeah.
You're correct.
Yeah. So,
Continue.
fast forward to me finding out more and more
blown
stuff,
away.
just seeing that the food packages were,
can't believe
the moms got $11 a month towards fresh fruits and vegetables. And the rest on the food package was low fat milk, low fat yogurt, cheese. Let's see, there was eggs, there was whole grains, bread, and peanut butter or beans, right? Yeah. So those were that was the food package that moms got to work with for, promoting health. So, and, I just started realizing, the whole low fat milk, they really pushed it. You couldn't get anything else. The yogurt, all of that was, we
Unreal.
had to push, you have to make your kid eat more low fat milk and low fat yogurt and all of that. And then just like the soy milk, the only non-dairy alternative WIC could provide is soy milk.
No
So-
almond, no coconut,
only
no
soy.
flax.
Only soy.
Only soy.
Yes.
What's the problem with that?
So many things. It's a hormone disruptor. And for growing children, no one should be drinking soy milk, first of all. But these kids are developing, and they're getting soy pumped into them from the get-go.
Does it have anything to do with hormonal balance changes between males and females, possibly leading
Right.
to later
It
confusion?
can make estrogen rampant in young boys,
So that would lead young boys to possibly doubt which bathroom to go into? Mm-hmm. Or make them think that they should identify as a different gender? You see where I'm going with this? How long has this been going on?
Oh,
Decades.
yeah, the longest time.
Decades.
Yeah.
So what you're seeing as, so at least the 70s.
Yeah.
So what you're seeing as an awakening of a generation to this new identity, and males can give birth and breastfeed and all this stuff. It was planned decades ago. Be not deceived.
Yeah. And then on top of that, most nurses and doctors that I know have absolutely no background in nutrition. And once I started figuring out all of this stuff, I would just be like, I don't care if I'm getting in trouble. This doctor's sending a prescription to switch this infant to an infant boy, especially, to soy formula. And I mean, I would be straight up with the mom. I'm like, you should not be putting your infant child on soy formula. They're like, well, that's what my doctor said to do. I'm like, well, your doctor doesn't know anything about nutrition. You're
Right.
talking with a nutritionist. You're calling into WIC. I'm the one you need to talk to. And if I'm saying you shouldn't be putting your infant on soy formula, that means nothing to you.
Right.
Why would I just be saying that?
Well, because you're going against the doctors who are gods.
Yeah, exactly.
So who are they
Even
gonna
though they
listen
have
to?
absolutely no background in nutrition. I mean, the nurses I would work with at the health department too, if we got too much WIC, they would help with some WIC. And they would be calling me like, we didn't get any training in nutrition. Like, what should I say for this, this, this? I'm like, you got no training in, I didn't know that until I
Right.
started working there.
Right.
And all of them said they had never been trained in nutrition whatsoever. My best friend that's a physician assistant has absolutely no training in nutrition. My sister's a nurse, no training in nutrition, nothing. So, that's who nutritionists are competing with,
Right.
are doctors that
Right.
are, they're gods, but they have absolutely no background in it.
Right.
So, when I started seeing that all these prescriptions come in for infant boy, on soy formula and all of that, it just like clicked with me. I was like,
Yeah.
this is crazy, and then just the pushing of the vaccines. And I mean, every other child was autistic coming in. And
How many of them, what percentage out of the autistic? See, you and I have never talked about this.
I asked about it because remember I told you that every autistic child is a boy.
Oh, yeah, we did. Yeah. you're
Yes.
right. I forgot about
Yeah,
that.
because
Say
you
that
said
again,
that in a
Lauren.
class.
Say
Every
that again.
autistic child I ever dealt with was a boy.
There's a reason why. And I teach in my classes, if any of you know autistic kids, what are the percentage? 99% of them are males.
Yeah.
That's not by accident. You got a 50-50 shot, right? Boy, girl, boy, girl, boy, girl.
So then,
to be
yeah.
that skewed is intentional. It's intentional.
So then every autistic patient that comes in, they have a therapeutic formula request from their doctor. And because they have sensory and eating, disorders and all of that because they're autistic. And what do they want them to be consuming? Pediasure. And
Correct.
we discussed what's in Ensure, Pediasure, and all of that.
Yes.
Just even more junk. So these children that are already autistic and struggling, they're just drinking Pediasure all day long.
All day long.
Right.
Exacerbating it, making it worse.
Yeah.
This is your healthcare system. These are your pediatric, population. When that happens for a generation or two, since 1970s, you think you might see some craziness happening 20, 30, maybe 40 years later?
And on top of that, with vaccines too, it's like every infant I ever dealt with at WIC, for the most part, has a milk and soy protein allergy. So
Where might that come from?
I don't know, maybe the vaccines that have milk in them.
We just talked about that 3 weeks ago, Shotpocalypse. I'm not sure, Amanda, what the date was on that. 2 weeks ago, that was the one that got us kicked off Vimeo. So this is a fun game right here. Watch this. We're gonna go. You already said.
Yeah.
But I want Jim, Linda, Whitney, give us one sentence that sums up to reiterate what Lauren's saying. Give us one sentence that tells us your nutritional education in nursing school.
Non-existent.
Okay.
None. Nothing.
Nothing.
I went to an Adventist university, so
Oh, yeah.
I had one nutrition class, and it was discussing the pyramid, pushing for the grains.
We have the winner. Okay.
Oh, you don't need that.
Had that back down to. So basically that's wonderful.
Yeah.
That just blew my mind. You guys get a lot of stuff out of that. So basically you saw a whole lot of things that just weren't meshing.
Yeah. Right.
Continue.
I mean, just
Wow.
pretty much the lack of nutrition and what the government was providing, because it's all government, subsidies and what they provide to these people. Or it's a government program.
Right.
So it followed the food pyramid. I
Right.
mean, tons of grains, low fat milk, low
Tons of
fat
grains,
yogurt.
Low fat.
Supplement with Pediasure if your kid doesn't like anything but chicken nuggets.
Uh-huh.
Yeah,
So,
right,
yeah.
right.
Might
yeah.
that explain some things that are currently going on in your nation
Yeah.
and in your churches and in your schools? Because secondary to healthcare professionals, I would say we probably treat, number two, we treat, probably the biggest number would be teachers and educational professionals. And the story again and again and again, to reiterate everything that you're saying, is they're tired of teaching. It changed since they started. They're tired of holding kids apart, putting a kid against a locker and putting this kid against a locker to keep them from killing each other. That's the story I'm constantly hearing. My family, I've got teachers in my family. I've got medical professionals in my family. It's the same story, and now you're hearing part of why.
Yeah. Yeah.
Interesting. Wow.
Mm-hmm.
This whole last thing just rolled me up and smoked me. That was crazy. That was crazy. Anything else about what you know from pre and then now?
I mean, now it's.
Well, you work here. Did everybody?
Yeah.
Did we know that?
Yeah, yeah.
I don't know if we even introduced that.
Yeah, I work here now.
I'm so sorry. we should probably explain that. I think I left that part out.
Maybe they'll pick up on the matching outfits.
Well, yeah.
Yeah.
They probably thought it was just bookends, But yeah, so you came on as a patient.
Yes.
And I remember when you started, I thought, oh, she's a nutritionist from bleep. We can't say. All right, probably shouldn't say, should we?
I mean.
Can we? Should we?
Yeah.
The county health department. So she came in as a nutritionist from the county health department, and I was like, well, the same question I ask every anybody who's in healthcare, or anything similar to it, massage therapists, whatever. If they're fitness people and trainers and stuff, I say, well, why are you coming to me? You could go down the street to get any drug or any procedure or any vaccine or any imaging test. Why are you coming here? And every single medical person will say the same thing. They'll say, I don't want what we're given. So you came in as a patient, and I
Right.
remember thinking this. I do. I remember thinking this. I think, oh, man, that'd be great if she wanted to work here at some point. that'd be like I'll just steal one right out of the enemy's basket, and
Yeah.
I'll just plant her here and like a water her like a tree, I remember thinking that, and I thought, but I didn't say anything, and we didn't talk about it, but I really put that out there, like, because we've been praying a lot for the right people to come, and the right people with the right heart, with the right passion. And so, she was a wonderful patient, and she, as all of these guys have been, and she came on board and started learning. You just started soaking it up.
Oh yeah. Right.
You read the books, watched the documentaries, came
Yeah.
to the classes, and
Yeah.
you just, like, she took off like a rocket. And I thought, well, if she's ever interested, that would be great. That maybe that would work out. And look what happened.
Yeah.
Yeah.
I mean,
Yeah.
I just.
Look at her. Aren't you proud?
Yeah. I mean, you'd think, you're just a nutritionist at the health department, but it was just so much more. Even I just thought that, like, I'm just a nutritionist. Why do I have to push vaccines?
Yeah.
Why am I being called to work at the testing sites, the vaccine sites,
Oh, yeah. Mention that.
Why am I pushing fluoride varnish, And I mean, it was crazy. And I was definitely sick of all the propaganda that's part of it. So
Yeah, and actually, you know what? Yeah, save the what I just told you to say. Save that, because that is something that you told me a little while ago that blew me away. That everybody needs to hear. We'll
Yeah.
talk about that when
Right.
we talk about the shots.
Yeah.
Very good. So you see the theme here. See the theme of profession is very different than what you started out in, and you've had to come to some realizations, and it's kind of a sea change from where you once were, thinking you were, like I think you said you were doing, God's work, or like, and like now you're seeing it as it could all have been prevented, or 75% of it
75% of it, yeah.
could be prevented,
Even cancer therapy now. I mean, a huge portion.
Oh, microphone.
I had.
Even cancer therapy. Yep.
So I will tell you that even though I've been doing this for a long time, we had I just come across and just learned the other day that one of the tests that we do,
We talked about this. Oh, yeah.
the
PET scan.
PET scan.
Yes.
So the
Check this out.
medication that we give you in order to have that PET scan locate tumors in your body is actually a highly concentrated sugar that's got a radioactive isotope attached to it. So the sugar finds the tumor. Now,
Say that one more time, Jim.
wait, so the
Say
sugar
that
finds
one
the
more-
tumor.
The sugar finds.
The tumor in your
tumor.
body. So does that mean the tumor is actually made up of sugar?
It eats it.
Or at least it grows off of it.
Yeah.
It
Uses
does grow
as
off
fuel.
of it.
Yeah. Use it as his fuel at least.
Right. Things I've learned since being at Divine Design. Totally rocked my world.
Yeah.
Yeah.
Yeah. So they take a radioactive isotope, attach a sugar molecule to it, and inject it into you. A lot of it. A big.
Right, yeah.
How many cc's of that? Pump it into you, and then it flows throughout your blood. I'll say that again. A radioactive
Correct.
isotope means a positive or negatively charged molecule, right? Attached to a sugar, lights up like a Christmas tree. They pump it into you, and then they put it, a PET scan is it shows up on a screen, and you can see where the stuff goes. And it accumulates in a little place that
Correct.
correlates with where your tumor is. Does that make sense?
Right.
Mind-blowing, huh?
Blew me away.
Right in front of your face, your whole life.
It was literally, it was, I knew because, you had taught the class and I had, done a lot of research and, watched a ton of the, the weekly things that you
The
you
WellWorks
do, and
classes.
The WellWorks classes. But that was kind of the defining moment where it all clicked.
What happened when you learned that? Did you just throw everything in the air and run out the front door?
It just,
What'd you do?
it made so much sense.
Right.
It made,
Yeah,
I did, yeah.
yeah.
Because I couldn't believe that, that's what was locating all these cancers.
Right. Yeah. The whole cancer industry. The whole cancer industry. Here in Amanda, is Amanda back there? Can you get me a schedule? Or if somebody has a schedule in here. We've got a class in, can you grab, just outside the door here. We've got a class on cancer called The Cure for Cancer coming up. And we'll talk about stuff like that. Absolutely.
Right.
Mind-blowing, huh? Jeez. Jeez.
Change me. Change me.
I remember we're at the front desk and you're telling me that. And I said, Jim, how long did it take you to figure this out?
Sometimes in life you hit that one little piece that's always,
Thank you.
Despicable Me, they call it, light bulb. That was my light bulb,
Light bulb.
so to speak. Yeah.
Wow, great. That's great. Anything else on that note? This is fire. All right. Well, let's get down to the last two topics. The last two chunks of this are all about censorship. And I bring this up because, well, you've already heard every one of us admit. I mean, I could tell you've heard me say it in classes before. I didn't learn anything in school, not anything that I use here. We don't do insurance. We don't do Medicare. We don't do any of that crap. So what I learned in school, just like with Lauren and Jim, right on down the line, was useless. So I don't tell people to go even, I don't even tell people to go to college anymore, let alone go get a master's degree or a doctorate. That's another story for another time. If you want me, moms and dads, if you want me to save you a couple $100,000, chat with me after this. But as far as education goes, we know that education is skewed. Well, you also know, if you've been watching anything that we do here, you also know that within the last year, censorship is abounding. So if you have crappy education combined with censorship of truthful information and propagation of crappy information, what do you think is going to happen in the next year to 5 to 10? So let's talk about that. I bring this up and I say, what is your view of censorship as far as what you know currently that's happening in this country? Let's just go right down the line. Start with you, Jim.
I mean, I'm a veteran, so I'm disgusted. I really am. I cannot.
Thank you for your service. Tell everybody where your service.
Army. I was Army for almost 4 years. But I'm disgusted that we're, in the place that we all fought for, that we're in a society right now where we're bringing up our children into a socialist, basically a socialist society. I mean, that's one minute fraction from a communist society.
Right.
Yeah, it's been proven over history that it doesn't work.
Right.
It destroys everything. And you know the injections and all of the injections that our kids now get in the sum. I think it's 80 now.
Upwards.
Upwards.
Ish.
Yeah, over 80 injections now that these poor kids are getting. That their immune systems, I mean, they just can't handle that volume. So, regardless of what's in the injection, it's ridiculous. So I'm a little bitter about the fact that our country is trying to be taken over right now by a bunch of folks that think if they give us things, that we're going to be much happier. The problem is we're going to be indebted to them, and at the end of the day, we still pay for our own control. So everything that you get, you pay for. It doesn't matter whether you're on Medicare, Medicaid, if you're on programs from the federal government or you're not. Every time you go down and buy something, all those taxes, you're still paying for what you're getting. You may be paying a different percentage, but you're still paying for those free things that you get. And we just finally have to take a stand against it.
Well, and what do you know about what's currently going on? some of the things that you know that are maybe happening in your realm, or some of the things you've read about in the news, or about censorship and what's happening.
Well, I mean, with the censorship right now, we're having a hard time to, Facebook alone is definitely manipulating everything. In the hospitals themselves, with all of the medications, all of the, the shots that, we're getting or being mandated to get. Fortunately, right now, I'm in a facility where we're not mandated. We're still respected on religious choice, so I'm very thankful for that. But I'm just kind of torn up with how much the government has really just stepped in and decided how we're going to be treated, what's going to go into our body, how they're going to manipulate us in the future. And I mean, all of us as Christians know, if you're, spoiler alert, if you go to the end of the book, it tells right there. You know the end of the story.
Well, list some of the stuff that you know that's being censored or being changed or being falsified.
Definitely all the COVID numbers, for sure.
Even in your realm, as you know that being a nurse.
So at the facility that I'm currently at, which I won't name because I still do work there, we don't have the COVID numbers that the population of Americans think that we have. We definitely have a lack of nursing staff. We have a lack of nurses' aid staff as well. So we have sections of the hospital that are closed off. We have beautiful, brand new sections that lay dormant, that we can't use.
Would you say that's just you guys, or would you say that's nationwide?
That's nationwide across the board.
You know that for sure.
Absolutely.
Interesting.
Because I was a travel nurse, still do travel nursing. And the astronomical money that hospitals are fighting for nurses just to get them in the front door is, I'm making at least double what I was making 6 or 7 months ago.
Wow.
Just because of the lack of staff, the lack of professionals. Wow. We cannot grow medical professionals fast enough to meet the demands right now.
Well, that's because so many nurses burnt out during COVID, so.
It's not that we are overwhelmed with COVID patients. To an extent, some areas very well might have been. But at least in this area alone, a lot of nurses got burnt out because we were overworked and underpaid. So a lot of them left to do traveling and went to the areas where COVID was more prevalent. So then we had a drop in our staff. And COVID didn't necessarily fluctuate in the area. Like maybe we had a rise in cases, but it didn't change the amount of patients in the hospital necessarily. What did change was the amount of staff. So like Erlanger, for example, downtown, they had about 50 beds that were shut down that they couldn't use. And they were like, oh, because COVID is just swelling. And a friend of mine that's a practitioner there was like, actually, no, COVID numbers aren't swelling at Erlanger. We just don't have the staff to open those units back up. So it's a falsified. The number might be right, but it's a falsified extent that we're being overwhelmed with COVID patients.
Right. Interesting, huh? And would you agree with that, nurse-wise? Would you agree with that, Linda?
Well, I'm not in the hospital currently,
Right.
but when I was doing an assignment back at the beginning with COVID up in the Boston area, what ended up happening for us was I was in pre-op and we ended up going out to the tent because they shut down surgery for a month, and I ended up going out to the tent to test and do all that, the COVID testing tent. But they hired all these travel nurses. They hired like 50 travel nurses, and they let them all go after 2 weeks because we didn't have the rise that was projected. But
Wow.
still, the numbers, what they were saying on TV in the Boston area was false for the hospital that I was at.
The
And for
numbers
the
they were
parent company
saying-
as well, the parent hospital
The
as
numbers
well.
they were saying on TV were false.
They were false in relation to the hospital. They were elevating the numbers because they had certain sections closed.
Right.
So do you see what I'm saying?
Yeah.
So so like
They made the percentage
and so
far greater than what
and they would
Right.
also put those patients into the ICU, and they might not have been ICU patients. They didn't really require ICU, but that was where they had the majority of the staff. So they moved them all to those beds. Does that make sense?
Did
And
y'all
I-
get that?
And at least this year, and I've been intermittent between ICU recovery and nuclear medicine, I have not seen one patient positive for flu this year. Not one has been positive for flu.
Why would that be?
I just haven't seen it. I've seen positive COVIDs with the same symptoms of a flu. I don't know how that works.
How
But I have
many-
not seen positive flu patients.
A ratio of, we need to test you.
Yeah. I think you saw me this morning.
I did. But so, how many positive people versus how many negative people? Once there's a test, how many are positive, how many are negative?
I don't personally know those numbers.
No idea? Just estimate? No idea? I mean, but have you heard of a lot of negatives?
You mean negative tests?
Yeah.
Yeah,
Yeah,
I'd say it's like 50-50, I'd say.
Wow.
And there are, the last time I worked in the ICU, I did take care of a patient who died, and she had had both COVID vaccine shots. So that does happen as well. That is very real, that patients do die after having the COVID vaccines.
That's real?
Very much so.
Okay.
Death is real, no matter what's inside your body.
Right.
Death is very real.
So, well, that's a good segue. Let's talk about the current events. What do you know then about what's currently going on? What would you say about the shots, about what's being propagated in the media? I know we kind of left off on your question earlier about some of the numbers that are being
Correct.
that are not real, right? The hospital numbers and stuff like that. So what's your understanding of the current campaign of vaccinations, the censorship, all the stuff that's going on? Give me the bird's eye view from each one of you guys.
So bird's eye view for me is that they're still pushing for all of us to have the vaccine. Right now, they're actually pushing for the COVID vaccine as well as the flu vaccine. Matter of fact, probably half the people that I work with in my surgical unit last week just all got the flu shot all at the same time. It's kind of mysterious that all my symptoms came after they all got the flu shot.
Interesting.
So what we know about shedding from a vaccine would mean that flu is probably pretty heavy in my department.
Right.
And even though my immunity is pretty good, it was worn down because I had a vacation and some family stuff go on.
Explain shedding for people who might not understand what shedding is.
So anytime you have one of these vaccines that's in your system, it's going to try and replicate that, whatever it is, whether it's a flu vaccine, COVID vaccine, it's going to try and replicate that in your body. Well, you sweat, you have breath that you give off, the human body has all different kinds of excretory systems that it uses. So naturally, if it's inside your body, you're going to start giving off, just like you were taught. If you cough on something, that's why I'm trying to hold this thing a little bit away and not cough on the mic. So, if you put that on those surfaces, somebody comes along and touches those surfaces, just like if you coughed on it, just like if you sweat on it, just like if you're, rubbing up against somebody or, you're wherever you're at. If that high percentage, you're in the lunchroom and, there's 10 of you eating lunch at the same table, you're going to be exposed to that flu the same as if somebody had a full-blown case of the flu right across the table from you.
Right. Let that
It's
sink in.
exactly the same.
Yeah.
There's no difference.
So what Jim's saying is the vaccine particles that are injected into people have to then go somewhere, and through the normal routes of excretion in your body or secretion, whether it's pee or poo or breath or sweat, there's only 4, that's it, those particles are then going to come out. So if you're surrounded by half your staff that got a flu shot last week, your chances of then reacting to some of those shed particles goes
Correct.
up.
Correct. So,
Yeah.
that's it.
Yeah. So vaccine. So what do you know? What have you seen? Let's hear the conversation that everybody came here to hear. 4 medical pros saying this is what's really going on.
Yeah. Well, I stopped working at the health department the last week of August, I believe. Yes. And that's when there's supposedly a huge surge going on of, COVID cases. Mm-hmm. Our parking lot was empty. We had the side of the building where National Guard is doing the COVID tests, and no one was ever driving through. We had to have people pull up for their vaccine appointments, but no testing. So we were the primary testing spot in Bradley County. Yet we had all these cases, but we were always dead. So just, let that sink in a little bit. That where are these numbers coming from?
Where are the numbers coming from? Mm-hmm. Once again, I see a lot of patients each day. And when I'm hearing the same thing from 3 or 4 different healthcare professionals that work in different places, and I'm hearing it all over the place, and I hear 3 or 4 different teachers that work in different schools, it doesn't take long to put this together and go, we're not being told the truth. So what are some other little nuggets of what you noticed there?
Is there something specific you want?
No, other than I think the thing that you told me that blew me away, the soup of the day.
Oh, yeah. So we talked about in last class.
That would be, yeah.
So every day there was a sign out on the side where you get your vaccine or your testing, and it says today's vaccine, and it would switch between Moderna and Pfizer. So what we talked about last week is that, you could get your first dose as Pfizer, and then when you're due for your appointment for your second dose, you could come back and it might be Moderna that day, because we would just get shipments at random. So there would never be we would never know what shipment we were getting. So we didn't know if it was going to be Pfizer or Moderna. So you were getting different vaccines if that was your day to come back for your second booster shot. So, yeah.
Everybody hear that? That's crazy, isn't it? So think about it. You've got an entire population in the world all getting shots, multiple boosters, multiple shots, different versions and doses of those shots from not 1, not 2, not 3, but 4 different companies, and that is the only solution to the ever-present trouble that we now know as what's going on in the world. Understand that. What you're saying is nobody was keeping track of, you got dose 1 and now we need to give you number 2.
Not that I'm aware of, no.
They're just sitting in a line and getting
you
whatever.
got your card, and on the back it says when to come back for your second dose.
Right.
So say you come back or you make your appointment for that dose and you come back and it's Moderna, you still take it.
Did anybody say, well, no, I need Moderna part 2 and you guys only have Pfizer today? I'll come back
I
later?
wasn't giving the vaccine, so I don't know if that
Oh.
ever happened, if someone
Right.
questioned that.
Does anybody know that answer to that? Oh, here goes.
Well, I do know I had one coworker, and he got COVID, and he's about the same age as me. He was Hispanic, and he got COVID, and he was actually in the ICU. He was proning. It did deal with him pretty bad. I don't know much about his health history. I do know he enjoys alcohol, but I don't know what his diet is. I can't tell you
Has
much
no
more
effect.
about him.
It has
but
no effect on anything. What you
Yeah.
drink and what you eat has no effect.
I don't know much else about him other,
Okay.
other than that. I know he likes to run, but so afterwards he was bragging, and I remained silent. But he was bragging, first of all, how people that are not getting the vaccine are the reason that COVID is still surging and people are dying. As of the last time I checked on him, which was a month ago, he has gotten 7 different COVID vaccines. He goes to different clinics, says this is my first time getting it, and just gets whatever they offer. So he's had Johnson & Johnson, Moderna, Pfizer. What is the other one?
AstraZeneca?
Yeah, AstraZeneca. He's gotten anything they can offer. He's taking it because he wants to really fortify himself. He said that he's doing it because to help out those who are choosing to get vaccine, he's trying to really fortify himself against the anti-vaxxers. That's a coworker.
And then to add on that real quick, one more thing.
7 vaccines.
Yeah, that was a month ago, so he might be at 17 now.
I mean, so I have a very reliable source that works in the ICU at a very big hospital in town or in Chattanooga. And she was telling me that people have been coming in for strokes and, you know, they had gotten both doses, but nothing's documented in their medical history that they took the recent vaccine. So just
Right.
remember all the blood clots going on with all the vaccines,
Right.
multiple people coming in for strokes. There's no
Right.
documentation of the vaccine in their medical charts.
So all of the so the facts can be. So not only is there massive censorship going on, we're being censored. Huge organizations, huge medical professionals out there, immunologists, virologists, pathologists, doctors, nurses, whole entire groups of people who just a year or two ago were widely renowned as being experts in their field. But they're being censored off of social media, they're being canned, they're being denigrated professionally, smeared. Why would that be happening at the same time as all of these people corroborating on what they're seeing in 4 different places? It's nuts. Let that sink in.
Another coworker of mine, she has chosen not to have the vaccine at this time. She left ICU and became a hospice nurse. And I ran into her a couple weeks ago, and she said she became a hospice nurse in about January, and cases were going okay. They had quite a few patients passing, work was work. But she said once they pushed for the second dose of COVID, she said the amount of patients that have died since getting the second vaccine have been incredibly exponential. She said it is constantly busy. And she said for most of them, they die because of strokes or clotting issues or exacerbation of their symptoms that they were on hospice already or they went on hospice afterwards after they got the second dose of the COVID vaccine. But the cause of death is often related to strokes, cancer,
Right.
kidney disease, kidney failure.
Right. It's never the vaccine.
It was not the vaccine.
Have any of you heard in your professional settings of anyone dying from the shot?
Absolutely not.
Absolutely not.
You think you ever will?
Absolutely not.
No, we never will. No. But I will tell you in my setting that the number of what we call a code stroke when an ambulance comes in with a stroke victim, those are definitely exponentially up.
When an ambulance comes in with a stroke victim.
If an ambulance comes in, is going to come to
code
the ER.
stroke?
They call what they call a code stroke overhead, which means that you got to get the CAT scan warmed up. They know that whoever is going to attend to the stroke victim is going to be in, let's say, Bay 12, and they'll be here in 3 minutes. Okay, so the number of overhead announcements that we used to hear were, you might hear a couple a week. Now it's very common to hear 3 or 4 a day.
Yeah.
Now, I don't know what they're from. I honestly don't.
But strokes.
But the strokes are definitely up significantly now.
Interesting. Does anybody that you work with, like, is anybody thinking that it might be related?
No, absolutely not.
If they are questioning it, they're not vocal about it.
Why? What would happen if they were?
Well, we're the minority at this point.
You are the minority.
I will
Right.
say that a big argument from medical personnel, those who have chosen to be vaccinated, a big push for them is when COVID numbers surge and patients that are admitted to the hospital, they have more often than not, about 85% of the time, they have not been vaccinated. And this is obviously a big push for medical personnel to say we should be vaccinated. My argument to this is, and why I appreciate people like you showing up and being educated, is more often than not, the people that have chosen not to be vaccinated that end up in the hospital are very non-compliant with how they take care of their bodies. So their bodies are often very immunocompromised. They're often very obese. They're often heavy smokers. They take 17 medications. They love their fast food. They just want me to bring them another Sierra Mist and a pain pill. More often than not, they don't take care of their bodies in general. So people like us that are taking care of our bodies, we are probably not going to show up to the hospital anytime soon getting COVID if we choose not to have the vaccine, because we are fortifying our bodies in the appropriate ways. So just know when you hear COVID numbers have surged, hospitals are overflowing, oftentimes they are overflowing with non-compliant people that have not been properly educated. And even if they were properly educated, they may not listen.
Well said. Well said. Yeah. Well, and so if we know the numbers are jacked up and we know the tests are jacked up and we know that the media is telling us, what would you say to people? What would your advice be to people? Anybody?
I think what we did, and that is begin to educate yourself, begin to ask questions.
You and your husband, right? Is
Yes.
That, yeah.
And
what you as your family did.
yeah,
And we'll
and
talk
just-
about you and the grandkids here in a minute.
Yeah. Educate yourself. And I would encourage, we talked about this when we were all waiting to come in here, and that is our education system is unfortunately flawed, and as is Google search. So when you are...
Get off Google.
When you are looking up information, it's important to know the resource you're tapping into.
Right.
Is it a .net? Is it a .gov? Is it a .org? Is it a WebMD? Is it a .com? Who supports those websites?
Good point.
You need to definitely look into it, because if you have no other resource, like the way I found out about Divine Design was I'm sitting at the hospital one day and I'm sick and tired of what I'm seeing, and I start typing in natural health, Chattanooga, Tennessee. I went through 8 different facilities, called all of them, left a voicemail saying I'm passionate about what you're doing. Only Divine Design answered the phone. Only Divine Design said, hey, we have a wellness workshop, come on by. So it comes
Yeah.
about stepping forward and doing the research yourself and educating yourself. Because if you don't take the step forward and educate yourself first, someone else will educate you, and they will educate you how they want you to be educated. So you have to stand up and look it up yourself.
Well said. Well said. And take into consideration what she's saying here. How many doctors' offices out there, some of you in this crowd work at doctors' offices. How many doctors' offices do educational stuff like this? Does anybody know of one? Raise a hand. Other than here? Interesting, isn't it? What's the word doctor mean? To teach. To teach. It means teacher. That's why you're here. Very good. Very good. So you just educated yourself. You did a Google search, which still works for the time being. But for a Google search. However, Google will throttle our results. If they're not already, they will. They'll keep us invisible to people who are searching.
I had to scroll for a little bit to find you.
I'm sure you did.
I did.
Because we used to be #1 in Cleveland. Well, and you probably did it from Chattanooga, so searching. But take it this way. We don't rely on Google or Facebook. We never have. We never will. It's word of mouth, friend and family referral. That's it. Because once we get you better, you go tell everybody in your family. That's how this works. That's why we don't advertise. So I could care less about Google. I could care less about Facebook. He built this, not Google or Facebook. So the thing is, you can use Google to search certain things, like a restaurant to go to or something like that. But if you're looking for like medical information or hey, what is chiropractic? It'll finish your sentence and tell you that it's quackery, pseudoscience, and that it's fake. Yeah. But don't ever think you're going to hop on Google nowadays and get real news, unbiased, uncensored, with real numbers from real facilities with real people who work there. Those days are gone. And on the tail of that, here comes censorship. So they're giving you fake news, plus they're making sure that you don't see the real stuff. Welcome to America, 2021, right? It's surreal, but it's real. It's happening. Linda, what would you say? What would you tell people as far as, and you can work in there like family stuff, the kids, whatever, grandkids. What would you tell people, knowing what they know now, what would you say?
It's not too late to change. I don't think it is at
Never.
all.
Never too late.
And it's not too early to start grandchildren. So we got here. We came in March, but how we started was we were in travel nurses in Boston, and we both had COVID, and we were out for 5 weeks. So much so we prayed so much. I prayed over Jim. There were 2 to 3 nights that I thought I was actually going to have to drive him to the hospital that he worked at in the ER and leave him. It was horrible. It was horrible. And after that, we started seeing Brittany, our daughter's friend. She comes here, and we started seeing her changes and things that were happening with her health. And
Brittany's your daughter's best friend and old roommate.
Yes.
So Brittany is a patient here.
Yep.
Yes.
So I started looking you up, and I started finding, looking at things. And
She started stalking me, Jim.
I did. I told you that. I was right up front.
Pushing you on me.
She knows what you need. That's right.
I hope so.
That's right. That's
So
right.
then when we moved here in March, you called and you got the appointment. We moved here like on a Thursday, and Monday we had appointments here.
Wow.
But then we've just been so excited about it because of all, I think, the lies that we saw, and especially going through COVID up in Boston, where that is a medical mecca. That is a medical community.
Right.
And I loved the hospital that I worked at, and I was buying the Kool-Aid, unfortunately.
You were
because
buying it?
I was.
You weren't just drinking it. You were
I
buying it.
was buying it because I was so proud to work there.
Right.
You don't understand. This was, yes, it's,
Yep.
and
Wow.
everybody goes around, they wear their school hats, and it's in the
Yeah.
OR, and it is, seriously.
Very
Yeah.
prestigious place that she was at.
Yeah.
Right.
In Boston.
It is. It's a community. So I believed the infection control doc, when he would explain COVID to us and, things like that. But then I started to see a lot of my coworkers that were getting the first and second shots, and they're out for 4 days because they are sick and they aren't coming in. And so there you are, you're taking on, a much bigger load in the OR and all that kind of stuff. And the one person made a comment, you know who she is, a coworker, and she said, "We're taking it for science, taking this COVID shot for science."
I'm doing it for the future.
I'm doing it
for my children.
Yes.
Yep.
And I started to just see differently. And
Just from that comment?
from that comment, well, now we've had COVID. So we had COVID early on. And so now we come back, and the shots, they're going to start giving everyone the shots,
Right.
the 2 doses. So by the end of the year last year, my eyes were opened. Jim's eyes were opened, and we knew we were coming here. So then we came here, and then all of a sudden, like the first week, I think we left like glassy-eyed, because I'm like, oh my gosh, I feel like I'm in a college class again, because now everything I learned is completely upside down. But I knew that. We knew that. So we took it in really quickly, because we knew what we learned was wrong. So we really just
Yeah.
kind of pressed it all down.
You did. I have to hand it to them. You guys just sucked up everything. They read the books, they watched the documentaries, they came to the classes, they were watching at home. And I think it was a heart class, I think, and you said, I learned more.
We heart you too.
Yep,
Was
we heart
one
you
of the
too.
one of the first classes that
Yeah.
really
Yeah. And
nailed it for me.
yeah.
Yep.
Wow.
Yep.
So they learned very quickly, which is in direct proportion to how well you do, is how how much information, how much you read and how much you take it seriously. So these guys
Yeah.
did it right. Go ahead.
And there's a lot. So like, take it, take the time and read it to really try to understand it. Right.
You won't regret one thing you learn here.
Yep.
You won't.
So then we started getting our daughter and son-in-law and grandchildren on board. And so now, we're helping them with their vitamins, with the 3 kids, with our grandchildren with their vitamins. And what a difference in behavior. So the 2 older ones are twins, and she has like a sensory processing
Correct.
issue. But the behavior, they listen, they look, they sleep better, everything about them, bright-eyed. My daughter went through the whole house, like she was like us. She went through the whole house and like took everything away.
Yeah, my poor son-in-law. I'm sorry if you're watching.
He'll
right
thank
now.
us later. It's okay.
Yeah, she changed everything just like we did. And it's so cool. It's so cool to know that they're going to pass this on now.
Yeah.
Because we're not going back. We're not changing because we
Right.
like how we feel. We
Right.
like the energy that we have.
Yes.
And
And they stopped all their injections. And
oh, yes. And yes, they
yeah.
did. They stopped all their
Yeah.
injections as well. So
Yeah.
there's
And
no-
this is coming from a medical family.
Yeah.
Right.
And this is the kids
So
and
there's
the
no more
grandkids.
immunizations for our grandchildren, which is awesome.
Right.
And that's just what we've done that's just what you've done in the last year?
March.
Since 9 months?
Yes.
6 months?
Yeah, 6 months.
6 months. So when people say, "Oh, I don't know, I just can't do this or that," the book takes me a long time to read. I mean, it's a little tiny book. Or
You can't afford not to.
You can't afford not to.
And what did I say at the interview? I said, you got to run here. You have to run
That's
here to
right.
get this information. Don't walk.
the video testimonial, yeah.
Yeah.
So there are people out there who drag their feet and will make excuses for, "Oh, I couldn't start this or that, or I couldn't fix good food this weekend because the in-laws were here, and next weekend it'll be because the kid has a birthday, and next weekend it'll be because Susie has soccer, and the next week." It's never a good time. It's like getting married or having kids. If you wait for the perfect time, you won't do it. So it's the same thing. And look what these guys did in 6 months. I love you guys. High five, high five.
Can I tell you what we did for my birthday was during our,
Oh, yeah.
yes, our cleanse.
Yes. How hardcore is that? 21-day purification, and she does it during her birthday. It's no big deal. Go ahead.
No,
Tell
we
'em.
made little banana coconut cookies.
Boom.
Right.
That's all it was. Banana
Yeah.
and coconut.
Yeah.
And we made it as like a cake.
Yeah. Who says you
It
have
was
to?
good. It
Who
was-
says you have to have a 72-layer
I won't.
Right.
Betty Crocker thing? It doesn't have to be. It doesn't have to kill you for you to enjoy it. Like, you're paying these companies to murder you. Get over your taste buds, like these guys did.
Right.
In 6 months. Well, less than 6 months. This is just where you're at right now.
Right. Correct.
You guys are hired. I want boatloads of Jims and Lindas. Jim.
So, I mean, what I really want people to leave with here, and this was what we were talking about really in the back room as well, is that it's difficult to come here. It's more difficult not to come here.
Amen.
I will say.
Somebody write
But-
that down. That's good, man. That's good. I'm gonna write that
But I mean, if you're
writing it down.
watching this or you're sitting here and you're not a patient here right now, and you find yourself with a lump or you find yourself with something that's just not right in your body, and you're not at this point of 4 months, 5 months, 6 months, a year in here of getting proper nutrition, changing things around, taking decades of what you've done and trying to reverse them in a short amount of time. Go see your doctor. Don't put off, breast stuff.
You wanna,
Yeah.
oh,
Yeah. Yeah. Don't put off breast stuff. Don't put off a tumor. It's really important to get those things looked at. Sorry.
You need some water?
No, I'm good.
Is he choking?
What's that? Yeah, you can change, where you're going, but don't not head to your physician because, you have this tumor, you have this thing that needs to be looked at. They're still an important part of what's out there for the general community. This path is super thin, it's razor thin to get into a program like this. To get this kind of education is super thin. So I see it too much. So, sorry, it kind of hits me. But, yeah.
I wanted to concur with your emotions. We wanted to serve the community in the best way that we knew how. And that's how most nurses, most physicians, assistants, dietitians, physicians, they're not all out thinking, yes, I get to kill another one with chemicals. That's not why we signed up for this. That's not why doctors go through 10 years of schooling. We want to help people, but we've been educated poorly. Don't let us educate you poorly. With that being said, don't just quit all your medications and saying, I'm going to eat lettuce for the rest of my life. There are healthy ways to do this. That's why when you sign up here, you're in a 12-week program where it is a slow weaning because you slowly became unhealthy. You slowly need to come back to health.
Correct.
It's not this sudden stop where you think it's all magic and rainbows just because you can turn like that. So there is a process. So if there is something medically going on, if you are on medications, if you are dealing with cancer, if you're dealing with an upcoming surgery, yes, reach out to people like Dr. Brett and get their advice, but don't just abruptly stop because we've seen it far too many times where patients try and quit what they've done to themselves for so long. And I've had patients die within 12 hours. Because they decided to quit things on their own. So there is a safe way of doing this. But the fact that you're here in the first place is that first step, and that's amazing. And we're proud of anyone that watches this, proud of anyone that asks questions, proud of anyone that shows up.
Right on. Yeah, I'll speak to that too for a second. Emergency medicine, I say it all the time. Like what Jim's talking about. If you break a bone, if you've got blood spurting out, if you have a massive trauma or an accident, do not forsake emergency help. I've never said stay away from emergency rooms. Emergency rooms are something that we do very well in the United States. It's the other 99% of stuff that is preventable and avoidable. And that's the stuff that everybody you know is on. Very few of you know anyone who was recently in a car accident or broke a leg or slipped and fell, but all of you know somebody who had an appointment just this week to get put on more meds. That's what I'm saying. So I work with these guys, love these guys. I respect everything they do. Were we all educated improperly, including myself? Absolutely. But at some point, just like they had to break out of it and turn the key and take the red pill, whatever the cliche is you want to say, at some point they had to break out of it, but I had to break out of it as well. Because most of you know chiropractors are just neck pain, back pain, headache, bone pop or back snappers that take your insurance and sign you up for 12 visits a year. You know, that's the stigma that chiropractors go through. Everybody's afraid of getting their neck broken. Oh, how can a chiropractor, how can a nutrition, how can any of that fix my diabetes or my cancer or my multiple sclerosis or fill in the blank XYZ condition? We've all, just that what I illustrated right there, what you've heard is wrong information. Just like what I had in school, just like what they had in school, just like what we all do in our professions until we decide to turn the key. So like we're all saying, get educated and tell people, because the people that aren't here are the ones that need to be here. And there is no time like now for people to wake up and see that the deck is stacked. It's rigged. Go ahead.
Yeah. And on that, I would just say to do your research. If you're watching this or any of the past WellWorks classes and you're angry and thinking everything we're saying or he's saying is false, do your research. Prove us wrong.
Yep.
Don't comment an angry comment saying, we're spreading false information. Do your own research. I mean, like what you always say, you'll never meet an anti-vaxxer that wasn't first a pro-vaxxer. And there's a reason behind that.
There's a reason behind that.
Yeah.
You'll never find someone who is against the shots who wasn't first supporting them.
Yeah. I mean,
Ever.
I got vaccines, 2 years ago. I mean, and finding out all of this stuff, it's crazy. And I did my own research. Someone said to me that vaccines were bad. So I was like, no, I got all mad. And then I started doing my own research into it. And I mean, here I am, Vaccines are very bad, turns out.
Yeah, she bought the Kool-Aid,
Yes,
she drank it,
yes.
she serves it to others.
And just do your research, and it really does. It's not fun to find out everything you've learned and went to school for is completely wrong. I
Right.
mean, no one wants to be wrong. No one wants to hear that. But at the end of the day, if it saves you and it helps you, it saves your life.
Yeah.
You can save other people's lives too. I mean,
Right.
and just if you're here or you're thinking about starting as a patient, or, you know, you're taking your program for granted, just realize that there are a lot of people that wish they could be in your position
Yes.
and have no clue. You're lucky to even know about this place.
Right. We have people driving from, I think, 12 states now around. And, you know, we have patients who are wonderful, and we have some who are kind of 80%, and we have some who are like maybe 60%. As time goes by, the 60% people, we will have them leave. And we will push those who are 80% on board and those who are 100% on board will take their places, because there's a need for what we're doing. And people drive for hours and hours and hours to get here because of what you're currently learning. So those people who don't appreciate it or don't do the homework or whatever, we have a way of finding who you are. Trust me.
Right.
And we often won't even allow them to be patients. We'll often cut them right out of the process before we even do an exam. We'll say we don't really want to waste our time. We think it might be better if you just go somewhere else. I'll be straight up with you. I'm never going to blow smoke up your butt. I'll tell you the truth. But what Lauren said right there, appreciate it. Do what we tell you to do, or do what we ask you to do, as long as we ask you to do it and we can assure you that you're going to get better.
Right.
Yeah.
Yeah.
All right. I see Jim looking at his watch. He's got some pasta on the stove.
No, the only pasta in my house now is let's see, there's green lentil pasta, there's chickpea pasta. They're pretty close. They're pretty close. She still makes family sauce.
I keep hearing this, but until I taste it, yeah, I bet. I bet. But see, that's one thing right there too. And in the community that we're building here, I mean, people get together and they talk about, after classes like this, you'll see people standing out in the lobby talking about how they changed their pasta sauce or how they changed their pasta. And it's not that hard. It does. If we all can do it, you all can do it. It's not that hard. Don't allow any food or drink to be your God in this life. Break free of the taste buds and the stranglehold that the food scientists have had on your mind and your neurology and your kids and your grandkids for decades. Man up and grow a pair and do what you know you need to do. Whether you're, it's 2021. Women can grow a pair too now. Yeah. Just wanted to cover that, make sure we're all inclusive. Yeah, we're all inclusive. I don't want to leave anybody out, In closing, just give us some closing remarks.
In closing, I mean, if you're out there and you've got, 15 different medications and you don't know where to turn, and you're questioning, is this going to be worth it? Can I afford it? You can't afford not to do it. You just can't. We were in a position where I really didn't have another choice. I was at the end of the rope. I was on as much blood pressure medication as I could be on. I wasn't going to get any healthier. I wasn't going out for a 5-mile run every day. I mean, look at me. I'm not a runner.
But we've got pictures of before and after.
I was a little,
and you guys.
I was a little fluffier, I got to say.
You guys look different.
But if you even have the inkling, look into it. Do some research. Get in here and be a patient. It will change not only your life, your family's life. It'll change how you feel about yourself. It really will. It's a fabulous thing to do.
Yep.
It really is. So thank you for having this place.
Thank you.
So, yeah.
Thank you for letting me help you and your family. It's a pleasure, man. Okay. Anything else?
I'd say.
And then we'll do some Q&A here at the end.
Yeah, asking questions is amazing. And if you ever want to ask your doctor a question about health or nutrition, do it. They should either get uncomfortable and say, well, we don't need to talk about that, and that should scare you.
Mm-hmm.
So ask your doctor, hey, what kind of food should I be on? If they say you can eat whatever you want, that's a red flag. If they say, oh, avoid sodium, ask them further. What do you mean by that? Where's the science behind that? Ask them questions. Challenge them, because maybe then they'll begin to challenge their education. You have a lot more power than you realize. You're not just some patient who is blind and has to succumb to whatever they want you to. Like, you
Right.
can question things. You're allowed to do that. Thank goodness we are still in America where you can question some things. They may
few
get censored,
things.
but you can question some things.
A few things,
And you
yeah.
have every right, when whatever comes into your body, you have every right to question everything about that and demand respect for yourself.
Right. And remember, you pay the doctors and the nurses. They work for you. And when people come here, I always remember that. They can fire me any day. And I've never, really had anybody do that. But you can fire a doctor who says, stay away from salt, even though you have to have it to live. Stay away from fat, even though you have to have it to live. You can fire your doctors, and you don't have to feel bad about it. The problem most people have is that's the doctor they're allowed to see because that's what Blue Cross Blue Shield allows them to have. And that's the closest one within a 2.5 mile radius of my house. So I don't want to change doctors. I don't want to offend somebody. Well, he's either going to help you or he's going to hurt you.
Just be careful, because conveniency often leads to complacency.
Absolutely. 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 Okay, what we're going to do, I know it's late, but you guys are all hanging in there. We'll take 3 questions. Yeah, you guys are hanging on tight. Oh, yeah? Oh, no, I'm sorry. We could have done some more comfy chairs for y'all. Look, we'll do 3 questions. Who we got here? Margie, what do we got?
Something was said earlier about autism and the growing that it's predominantly male.
Yes.
You mentioned something about soy just before that. Are we finding that soy also is a kind of tied together with the autism?
Yeah, go ahead and answer
Did
that.
the people online hear a question?
Well, repeat the question. So Margie's saying, is soy, we got to repeat it for the recording. Is
So-
soy affecting autism?
Or tied to it, yes.
Well, I mean, I was leaning more towards soy disrupting, the reproductive issues in males. So like what you're saying, it doesn't make a boy want to dress like a girl in the future because soy can disrupt, the hormones and boost estrogen in a boy. So especially during development, that's what we were talking about. But I was talking about too the vaccines because we've talked before about how
Yep.
vaccines around 2 is when they start to detect autism in boys.
Right.
And
When they have the MMR.
right.
Which is, yeah,
Tied to autism,
the majority
Right.
of their shots are before the age of 2,
right.
which is when a lot of hormonal things happen between male and female infants. We won't get into all the physiology of it right now. But the short answer is, does soy affect it? Your hormones? Absolutely. So is there a correlation? Yes, but you'll never hear a medical doctor say that.
Right.
Yes. Something that changes your hormones? Yes. Does it affect that? It has to. Yeah.
And almost 100% of the soy crop in America is GMO now anyway.
You can't buy soy in the United States that's not genetically modified.
And if it says non-GMO, then it's been very processed.
Yes. And corn is the same.
A lot of nutritional value.
So you guys who are big corn heads, it's all GMO. Well, I thought corn was healthy. It used to be. The same as bread, wheat. It's all genetically modified. So yeah, that was question number 1. We'll do 2 more questions because I appreciate these guys being here, and I want to get them home before Jim's noodles boil over. I love you.
I'm good. All beef kielbasa in the car.
Just
No
checking
hormones.
it.
All grass fed. No additives.
Look at this guy.
There you go,
There
buddy.
you go, buddy. There you go. Take that. Okay, question. Let's do another question for these guys. Question number 2. Who's got one? Anybody?
This is more so like a testimony of how your doctor works for you. You don't work for your doctor.
Right.
I started opening my eyes to a lot of stuff like 2017, 2018. I was pregnant with my second child. And I stumbled upon some like holistic crunchy mom groups on Facebook.
Love those.
And I kind of started questioning things like, are these moms crazy or they really know what they're talking about? So anyway, I have my son. I take him, to the pediatrician, and he was 2 months old, right? So it was shot time. And I'd been starting to read and question, and so I tried to ask her, hey, I'm kind of concerned, why is he getting like 5 or 6, different multiple things? And then she kind of tried to scare me by telling a personal story. Oh, well, when my son was little, he got this, and he was hospitalized, and it was, really awful. It was, of course, something that she had a vaccine for, because we only have to be scared of things that we have vaccines for, right?
Right.
All the other viruses and stuff can't kill you.
Right. Yeah. Totally. Good point.
So I felt kind of bullied, and I guess I didn't have the knowledge then that I have now to really, I guess, kind of stick up for myself, like, spit facts at her. So unfortunately, my son ended up getting vaccines that day. And afterwards, I cried because I felt I didn't advocate for my son. And if I'm not advocating for my child, who else is? And I was so emotional and fired up. I was mad at myself. And I was mad at the doctor for, instead of listening to, my concerns, she just shut me down with like fear, right? Well, if you don't do this, this could happen.
You will know them by their fruits.
And after crying and feeling bad about the choice I had made, I called that office to say, we're no longer going to be patients there. And of course we were discharged because she didn't want,
Non-compliant.
if you're not going to vaccinate your child, then you're not welcome in my practice.
Right.
I later was reading more about how pediatricians get kickbacks at the end of the year. Blue Cross, Blue Shield, what I read, they get a $40,000 bonus at the end of the year if X amount of their patients are fully vaccinated, included with the flu shot. And that made me even more mad. I was like, she did not care about my son or my concerns. She cared about, whatever bonus or kickback or whatever she's getting.
Right.
And after that, I don't know, I went like full out holistic, like.
Crunchy. Well, and you guys, do you all know that to be true as far as?
Absolutely.
I don't know about the vaccine, but there are bonuses and kickbacks for sure. And there are penalties too if you don't.
Right.
And I mean, I feel my heart like rising right now just talking about it.
Mm-hmm.
But as a parent, it's intimidating. It can be intimidating to ask your doctor questions. And then, have them just try to scare you and come at you with fear.
Well, but always remember that, like Celia is saying, it's a question of who's working for who. You're paying their bill. But at the same time, always remember, logic and emotion cannot go together. So they're trying to use emotion on you with fear, not faith, fear, to get you to think illogically. Mm-hmm. They're manipulating your emotions. Well, what about polio? What about smallpox? What about this? What about that? Okay, yeah. It's the same crap all the time. So just FYI. What kind of song is that, Karen?
Okay.
Karen. Wow. That's the fastest I've ever seen her move. She grew wings just now. She flew out of that door. So, Celia, yeah. Does that make sense?
I have one more thing to add to that, like a different experience. As a mother with my kids, she brought this up with the fluoride that they like to paint on the kids' teeth.
Fluoride varnish, you called it?
I also had that happen. I took my older son to the dentist, for his 6-month cleaning. Well, they want to paint fluoride, and I was like, hey, I'm not cool with that. I don't think that's necessary. They got mad at me.
Absolutely, they did.
They said, well, you can skip it this time, but in 6 months when he comes back, we'll have to do it. I was like,
incorrect.
LOL, no, we're not going to do that.
Incorrect.
But just coming, as a standpoint as a parent, you have to stick up for your kids. You have to tell the doctor, the dentist, or whoever, I'm not down with that.
Nobody's going to do it if you don't do it.
And it can be intimidating, but over the years, the more knowledge that I've gained and the experience that I've endured, I feel so confident now. Like, these are my kids. Like, no.
Yep.
And I know that I've helped some of my other friends who are also moms kind of gain their confidence.
Yeah.
And
Good for you. That's great.
If you're questioning something, there's nothing wrong with telling a doctor, hey, I'd like to reschedule this visit. I want to go discuss things with my family. I want to go look up my own stuff. And if they get salty, be like, again, I'm just going to reschedule. So that way you have time to step back from the situation,
Yeah.
do your own research, come to your own conclusions, pray about it. And if you decide to go back, then it's in your power. The ball's in your court. And you can
Yeah.
make that decision to do so.
And understand, if you're going to a medical doctor, I said this a couple classes ago, if you're going to a medical doctor and you expect herbs and supplements, it will never happen. It's not because they're bad people. It's because it's against the law. They can't do it. It's not their license. It's not the law. They need to put you on drugs, give you procedures or surgeries, or give you procedures that point to drugs and surgeries. That's the formula. So if you're going to a pediatrician, my question to mothers to make them think is, why are you going to the pediatrician? They say, well, I have to have. Well, who said you have to have? Is it a law? And then they realize, they go, well, yeah, I don't want the shots and I don't want the antibiotics and I can weigh and measure my own kid. Well, you just saved yourself a bunch of money and probably a lifetime diagnosis just by simply saying, why am I doing this? You know, do I really need this? Do I need a pediatric specialist for my kid? Think about it. Everybody thinks they need to have a pediatrician. Think about it.
Thinks they need to have a primary care.
Right. Well, and the thing is, yeah, everybody thinks they need to have a primary care. And I will have you know that given the current political climate and what's going on in the media and medicine and pharmaceutical industries, chiropractors are considered portal of entry primary care physicians in all 50 states, FYI. So you can pick whoever you want to be your primary care physician. Just don't come to me and think I'm going to give you drugs or cut you. Those are the only two things by my license. Yeah, I will blow up your spine and I will rip your head clean off. But don't think that I'm going to cut you or drug you, because that's not my license. If I would have wanted to cut you and drug you, I would have gone to medical school. I didn't go to medical school. I went to chiropractic school. So understand what they're allowed to do and what they're not. They're going to drug your kid, they're going to cut them. Or they're going to give you procedures so they can drug them or cut them. Am I right?
Yeah.
Or is that way off?
Nope, exactly correct.
I'm sitting here with 3 nurses and a nutritionist, and you agree with what the statement? It's against the law.
Correct.
Okay. Last but not least, anybody else? Jane, I think you had something. And then we're out.
So research is very important, and we're called to do our own. So if we're not using Google, what do we do? Where do we go?
DuckDuckGo. I've said it a number of times in classes. DuckDuckGo is a search engine. Yeah, libraries. Go to books. Get off Google. Get off the internet. You are not going to see the truth on the mainstream media. You're not going to see the truth on CBS, NBC, ABC, Fox. DuckDuckGo is a search engine. Just type in DuckDuckGo and .com, and you can go use a search engine. That's a search engine, just like Google, just like Yahoo, just like Bing or whatever. But you can search things, and they're not going to track you, and they're not going to influence you with the.
There's no algorithm.
There's no algorithms to make you search. You type in chiropractic, and you say, you know, chiropractic killed 759,000 people. Oh, I better click on that one. That sounds like an interesting story. It finishes your thought. DuckDuckGo does not do that. And you can download it on your phone. You can put it on your computer. So you're not using Google, and they're not searching you for, like, if I want to search, you know, who came up with Let's Go Brandon?
Buy him a beer.
So I can buy him a beer. That is storing your IP. It's storing what you searched for. So, I mean, I search for a lot of sensitive stuff. I don't want, you know, Google tracking that and attaching it to my ID and stuff like that. So you can do that. You can use VPNs to route your computer through another country for various reasons. There's a million things, but get away from Google, get away from Bing. Don't just pull up your browser on your phone and search for and use the first thing that comes up. you don't do that, because it'll be Google. 90% of the time, it'll be Google. There's a million things you can do to get good information. Is that what you're saying?
Yeah.
Where do- Yeah.
So when it just pops up at Google, you initially put in
Yeah, you s-
I've got both, but
Yeah, you can save DuckDuckGo as a link on your home
Your primary.
home screen. You can, or you can just save it as your primary.
You
Yeah.
can download DuckDuckGo as an app. So
Yep.
I use DuckDuckGo as a search engine app on my phone.
Yeah.
Nadia will do it for you. She did mine last week.
Yeah, go to our IT department at the front desk and ask for Nadia. Sorry, babe. What were you going to say, though, Lauren,
Oh,
about that?
and if people want, because I know a lot of people, they want scholarly information. All of my research papers in school, I had to use like PubMed or
Yep.
scholarly based articles. That's where I did all of my research when I started finding out vaccines were bad. It's on there.
Oh, yeah.
Published articles on PubMed that I had to do my schooling stuff with.
Yep.
There's vaccine research, and I think the first one that led me to it was SIDS and the Tdap shot.
Oh, yeah.
And
That's a
it
good
was
one.
all on there. 6-month-old babies get their Tdap shot and then all of a sudden die unexpectedly from sudden infant death syndrome. It's on there.
It's on there.
Peer-reviewed articles.
Yeah, peer-reviewed. Scholarly journals, peer-reviewed articles, they're all on there.
Yep.
And you can show these to people that try arguing with you, and they send you a CNN article. Well, you can send them a scholarly journal. Yeah.
Yeah. Yeah, and keep in mind too, like the PubMed stuff it's scholarly journals. It's written by PhDs and research scientists, stuff like that. But that's all of the scholarly, heavy-duty research level stuff. It might be a little wordy and over your head, but that's what. And some of it is bought and paid for. I mean, you can also find a lot of stuff on the flip side of that. You can also
Right.
find a lot of stuff that says drugs and surgery are the savior of mankind, and that's all. That's the only way we're going to fix this problem.
If you want it bad enough, you'll find what you're looking for.
Yeah, right. And so there's a lot of research out there, but nowadays you have to ask the question, who paid for the research? Is it a company that is profiting from the drug? There's a video circulating around on Telegram and everything else. It's like I forget how many minute video, but it's quite extensive in all of the headlines and all of the journal articles. The headlines saying the vaccines are safe and effective 100% of the time. But they go by like really fast. There's hundreds or thousands of them. So it's just showing that a lot of the information can be bought and paid for now. But it's interesting because pre-2010, pre-2015, everything that she's talking about, you'd find articles going back 30, 40 years about
I mean, I found these
vaccines.
articles back in 2019. Who knows if they're even up anymore?
Right, and they can disappear like that. That's why if you find something like that, print it, or save the PDF to your local drive. But yeah, so there are options out there. And as far as who to listen to and what to listen to, I've got rules. Nowadays, if they're not censored, I don't listen to them. And I'm buying books from Amazon because I know those are going away. If there's a book that you want or a book that you know of that is very controversial, like I'm buying vaccine books like it's the end of the world. Wait a minute. It kind of is. So there's a lot of stuff that's going to go away, going to go bye-bye. And you got to be careful where you're finding your information now. Here's a question to ask yourself, too, to close up with this. You have to ask, what's their motivation in telling me this? Like for us here, I mean, Jim's not making money off you taking the shot or not taking the shot. None of them are making anything. Well, I mean, Lauren's on the clock right now. That's a good gig, isn't it? Other than that, yeah. Other than that, I mean, these guys aren't being reimbursed to tell you how great it is to come here or, what miracle workers we are or any of that nonsense. They're talking out of their experience and their education and their background, their profession. They're just telling you to help you. I don't make any money from telling you that what the shots, 2 weeks ago, last week, we showed what's in the shots. We talked about who's pushing them and why. I'm doing this for free. I'm not getting paid right now. Why would I do this if it wasn't to say, hey, I'm treating you the same way I would treat my mom and my sister? So you have to look at the motivation of the people who are telling you, take this, we'll give you $1,000, we'll enter you in a lottery, we'll let you go to school for free, we'll give you Krispy Kreme, a burger, a beer, and a joint. You will know them by their fruits, not by what they say. You will know them by their works. Period. That's where you get your information. And, well, people like this, people who care about you. Anything else? No? We ready to shut this thing down back there? Fabulous. All right. Before we do, though, and just so you know, the schedule, Shotpocalypse, was October 4th. That's the class we're talking about that got us kicked off Vimeo. That's all about the current Shotpocalypse and what's going on. October 11th, that was a couple weeks ago, or last week, I'm sorry, diseases that don't exist. We went through a lot of things that you might think are diseases that really are just symptoms. Might want to check that out. October 18th is today, of course. Next week, we're plugging movie night. I promise you it'll be something fun. I promise you it'll be something you can't find anywhere else. And then November 8th, this is why we brought this in earlier. I have a class on November 8th, The Cure for Cancer. How many of you want to know about the cure for cancer? 2 of you. Perfect. They're coming. The Cure for Cancer. November 22nd is the 5G pentagram. If you want to know what's going on with radiation poisoning, why people can't smell or taste, why all these things are being diagnosed as symptoms of a disease where they don't have an isolated virus or any virus that's purified, you might want to come to that one, November 22nd. December 6th is Hands in the Air. That's your chemtrail class for all of you who want to know. December 13th, you're full of it. That's your water class. So we're going to be talking about food, air, water, cancer, vaccines, all the stuff you won't hear at your doctor's office and half the stuff you won't even hear at your church. That's why you're sitting in pews. Hallelujah. All right, so we're going to shut this thing down. So any closing words other than Jim's got to get home to his, pasta here? Yeah, I'm coming over. Everybody come with us. Jim's cooking. Yeah.
Jim's cooking.
All right. Well, thank you guys. Mangia. Good Italian. But thank you guys for coming. I appreciate, everybody give them a round of applause. We appreciate not just your service, but we appreciate you coming and saying what you've seen and your background and sticking around and answering some questions if y'all are so inclined in the lobby. But I'm Dr. Brett Spradlin. This is Divine Design, Natural Health, and we will see you next week for movie night, which will not be televised. So we thank you very much. Take care.